Okay, good evening, everyone. We will call the meeting of the DuPage County Board of Health of December 10th, 2020 to order. Before we take roll, let me read the appropriate language. Pursuant to Executive Order 2020-07, 2019 ILEO 20-07, issued March 16, 2020, during the duration of the COVID-19 gubernatorial disaster proclamation, the provisions of the Open Meetings Act 5 ILCS 120 requiring or relating to in-person attendance by members of a public body are suspended. Specifically, the conditions of 5 ILCS 120/7 limiting when remote participation is permitted are suspended. Per section 2.02 of this act, today's meeting is being conducted remotely and being live streamed for the public's viewing. This meeting is also being recorded in compliance with the Open Meetings Act. The DuPage County Health Department is the lead agency for DuPage County in response to the global pandemic, and as such is currently closed to the public except by appointment and adherence to public health guidelines and for the protection and safety of the public and staff. Also, because we are dealing remotely, all of our votes will be via roll call. With that, Penny, would you call the roll, please?
Ms. Bottoms?
Here.
Ms. Finch?
Here.
Ms. Geider?
Here.
Dr. Hussein?
Here.
Dr. Munir? Oh, she's not there. Dr. Scouten?
Here.
Mr. Spadoni?
Here.
President Tornatori?
Here.
Dr. Weeks?
Here.
Dr. Wilson?
Here.
Mr. President, you have a quorum.
Thank you. I would entertain a motion to amend tonight's agenda to move the public comment portion of the agenda to after public health updates, and also to amend items A1 and 2, and just flip those so that 2 becomes 1 and 1 becomes 2. I have a motion for that amendment, please.
So moved. Second.
There's a motion by member Geiner and seconded by Dr.
Wilson.
Wilson. Roll call, please.
Ms. Geider?
Aye.
Dr. Hussein?
Here. Yes.
Dr. Scouten?
Yes.
Mr. Spadoni?
Yes.
President Tornatori?
Aye.
Dr. Weeks?
Aye.
Dr. Wilson?
Yes.
Ms. Bottoms?
Yes.
Ms. Finch?
Yes.
Mr. President, the motion passes. Oh,
Thank
and
you.
Dr. Munir is joining us.
Yes, I'm here. Yeah.
Okay, great. The motion is and the agenda is so amended. Welcome again. Thank you for joining us this evening as we head into the final meeting of 2020. It's difficult to believe that for 9 months we've been consumed with COVID-19 and the public health response. I think we all remember that Sunday that we all got together at the Kurzweil Center and had that press conference. Karen's going to provide us with further updates in her report tonight, but I wanted to thank all of our staff and publicly talk about the appreciation that this board has for the efforts that have taken place and that the products that have been created by our dedicated, talented, and professional staff across the agency. Before we get into a little bit of a bittersweet situation, there are a couple of things that you may be aware of and those that are looking in tonight. We have apparently over 225 public comments tonight, which will be read by members of the DuPage County Health Department as per the Open Meetings Act requirement. That is going to take some time, and we appreciate all of those who have given of their time to tell us how they feel about certain things, and we will certainly take that into consideration. We're going to be, for those members of the board, we're going to be looking at the public comment portion of our policy, as well as members and who can or can't be a member of this board, and we'll report back to the full board in February with some suggestions regarding bylaw changes and amendments. Also, just as a housekeeping matter, we're going to get to it later on. There is no January meeting, as most of you know, and what we would customarily do in February with our retreat is going to just be a regular meeting because our staff at the health department is going to be a bit busy in December, January, and February with a vaccine, and to ask them to put together a one-day retreat would be a bit much. So we're going to have just a regular meeting in February. With that said, tonight, we say farewell and thank you to Board of Health member Bob Larson. Illinois statute outlines that with our bylaws support, the Board of Health is comprised of 2 members of the county board, those being myself and Bob Larson. One of our county board members, Bob Larson, no longer holds a seat on the county board. So after 10 years of exceptional support and dedication, we'd like to honor his outstanding service. We looked for every loophole available to keep Bob on. I think that he's going to stay, if you will, close to us. And my hope is that he will be back on this board very, very soon. I do want to thank him for his leadership, his dedication, his honesty, his hard work, and his friendship for the time that I've been on this board and also the time that I've served with him on the county board. And with your indulgence, I would like to read the following resolution honoring the service of Board of Health member Robert Larson. Whereas Robert Larson served for 20 years in the Marine Corps and the Reserves, rising to the rank of Lieutenant Colonel before retiring in 2011. And whereas Robert Larson was elected to the DuPage County Board in November 2010. And whereas Robert Larson was appointed to the DuPage County Health Board on July 24th, 2012, and served until November 30th, 2020. And whereas Robert Larson gained a reputation as a compassionate leader due to his service as the chairman and then a member of the DuPage County Health and Human Services Committee and his undying devotion to serve the neediest in our community. And whereas Robert Larson served as the DuPage County Finance Committee chairman, where he was known for advocating for efficient services at lower cost for the taxpayers of DuPage. And whereas Robert Larson combined his skills as a leader in government budgeting and compassion for those in need of services in the area of health and human service as a member of the Board of Health. And whereas the DuPage County Board of Health built the Linda A. Kurzweil Community Center on budget and on schedule during Robert Larson's board tenure. And whereas Robert Larson's leadership at the county board and health board resulted in a 10-year period of cooperation between the boards and an increase in joint programs and initiatives such as the HOPE Task Force to better serve the clients of the DuPage County Health Department and the taxpayers of DuPage County. Now therefore be it resolved that the DuPage County Board of Health recognizes the service of Robert Larson as a Board of Health member, and be it further resolved that this resolution shall be in full force and effect from and after its passage and approval as provided by law, passed and approved this 10th day of December 2020. C.M. Tornatore, President, DuPage County Board of Health. I'll entertain a motion to approve this resolution.
So moved.
Motion by
Second.
Dr. Wilson, second.
Yes.
Second by everybody. Well, let's take a roll call. Let's make it official. Go ahead, Penny. Penny?
Dr. Wilson,
Thank you.
Amen.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Geider,
Yes.
Dr. Hussein,
Aye.
Dr. Munir,
Yes.
Dr. Scouten,
Absolutely, yes.
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks.
Emphatic aye.
Mr. President, the motion passes
Thank you. And the
overwhelmingly.
resolution passes. Bob, thank you very much. Thank you so much. Bob, I'll give it to you to say whatever you feel like saying.
Well, it's like you say, it's a bittersweet occasion. I've been greatly honored to have served with this board over the last 8 years. It's given me more than I've given to it. I was 20 years in the Marine Corps. I served with a lot of heroic people that were better than me. And I loved that opportunity as I did on the county board. And this was another of those opportunities. Every year I speak about the work that we do as a board to get to our budget process and the things we do. And I don't do that just for aggrandizement because I really believe in what we do here as a board. The people of DuPage County are better because of what we do, not just this board, but the incredible staff that supports this board. Karen's work, the work of the directors before Karen that I've worked with, and all of you in providing the leadership that has genuinely made this the healthiest county in the state and a great place to be. Don't know what the future is going to hold. I'm still keeping my options open, so I may not disappear forever, but it's been a great honor to work with all of you. I know it remains in great hands with all of you, and all I can say, as Dr. Hussein did, thank you for giving me an eye on one occasion at least. Sense of humor. It's going to be a challenging several months to come. I hope the times that I've been joking around have been taken in the spirit in which they were intended. I do believe we've got to maintain our sense of humor as we go through these challenges, but I also believe in the genuine importance of what we do and what we've done here. So God bless all of you. I hope you have a very healthy and happy and holiday season. Everybody stays away from COVID and we get past this and on to bigger and better things in 2021. Thank you all.
Thank you, Bob. Thank you. Thank you so much. I'm
And
sure we
respectfully,
will.
I'm not going to stay for the 2 hours.
No, we wouldn't expect you to. But again, thank you for your service. Not only have I served with Bob on this board, but the county board. And when he was chairman of the Health and Human Services Committee, I was his vice chairman for 6 years, and we served on that committee for my 8 years on the county board. So I know that his dedication to the health department, to the care center, to the community services department, whether you talk to Janelle Chadwick at the care center or Mary Keating or Karen Ayala, they all will tell you that Bob Larson is one of a kind, and I would second that as well. So Bob, have a great Christmas and New Year's and happy holiday to you and your family. And I look forward to seeing you very soon, my friend.
Same
Congratulations.
to all of you. God bless.
Thank you. Moving on, we will go to public health updates, and I'll turn it over to Karen for the COVID-19 update and vaccine planning. Karen.
Thank you. So yes, I think this is actually the 9th presentation on COVID for this year. We'll start with kind of using the next slide as a visual to remind us that we began this phase in January, or we began this response with phase 1 in January. And probably unlike other responses or other diagrams such as this, we just kept picking things up. There wasn't anything that really fell off our response framework or our set of strategies as we moved across the timeline here into where we're at right now in phase 4. We simply kept adding to, and I think that is the acknowledgement that staff so very much appreciates from this board, that they have continued at every opportunity to kind of double down, lean in, and ask what else is needed. And so now we find ourselves at the mass vaccination, not only planning, but distribution. And the importance of this, the excitement of this, the need to make this as effective as possible pretty much dwarfs everything that we have done up until this point. So let me, in the next slide, just kind of go through very quickly where we're at with disease monitoring. We have continued to see increases locally. We're more than 4 times where we were in May with our case numbers. We have had many days, tragically, over the last 30 in which our number of deaths, COVID-related deaths, has exceeded single digits. And we continue to see an expansion of not only frail and elderly and severely compromised individuals, but we also see younger individuals coming as well. Next slide, please. We have continued to maintain through our dashboard as well as these reports, a day by day with our dashboard, a day by day update for ourselves and our residents on what is happening with COVID. And then our truly amazing EPI team has continued to provide us with weekly updates, which allow us different glimpses into an analysis into how the epidemic is really affecting DuPage County residents. And again, neither one of these is a requirement for local public health departments. However, it's something that we felt very keenly that not only did we owe our residents, but our residents would be interested in. Next slide. Another of our more visual or high profile efforts has been around our testing sites. And as you remember, we have had the DuPage County Complex Wheaton location open since mid-June. Early on, the challenges were heat and dehydration, and those have now switched as the seasons have changed. We have the capacity to perform 600 tests per day. And prior to Thanksgiving, we were far outstripping that capacity. We would open our doors for testing at 7 and have all 600 vehicles queued up by 8:30 or 9. And so we expanded in late November to another location in Villa Park at the ODM Expo Center. You will see based upon the numbers that although we have the capacity there to conduct 600 tests a day, we've seen since the end of November a reduction in the demand for testing. I do think that it is a lull, and we have certainly heard from our state counterparts that they are also seeing that. But now with some of the resurgence of disease activity from after the Thanksgiving holiday, again, our numbers are creeping up. Next slide, please. Again, this hasn't been updated completely, but you'll see that at least at the county campus sites, testing site, we have served, although by far the most people from Wheaton, the village of Wheaton, it really has served the county overall based on these numbers. But now, as I mentioned, we will continue to those efforts. We will need to continue our public education. We will need to continue our testing. We will need to continue our contact tracing and case investigation efforts. But now we also need to address the vaccine distribution. And hopefully you all heard the news from the FDA today that they did in fact approve the vaccine. There is one more meeting, which I understand will be held on Saturday, I believe it is, or Sunday, could be Sunday, for vaccine distribution is rolled out. But let's go through now what we do know. One of the frameworks that we have been pulling from through this whole response is CDC, and whether that be for any of the other buckets, alternate housing, case investigation, that kind of thing. We have relied upon CDC, and we continue to rely on CDC. And the overarching goal is to vaccinate our residents with confidence. We need to reinforce the trust in this process. We need to empower healthcare providers so that they can encourage and recommend vaccination to their patients. And then finally, we need to engage communities and individuals. And actually, the goal of getting this vaccine out is pretty unprecedented in terms of both scope, meaning everybody, and volumes, and then just the quickness at which it has unfolded. Next slide, please. Yes. So we knew that as of December 1st, ACIP, the Advisory Committee on Immunization Practices, as it does for every vaccine, approved the recommendation for this vaccine to proceed. When a COVID vaccine is authorized by the FDA, which is what happened today, and now the ACIP will provide a further recommendation on Sunday. We know that the initial phase, and CDC has outlined that to be phase 1A, can commence. So let's look at what those phases or tiers, or before we get to the phases and tiers, let's first look at the vaccine themselves. The vaccine that was received FDA approval today is the Pfizer vaccine. Also in queue is the Moderna vaccine. You see that they have very high effectiveness rates when 2 doses are provided. The Pfizer vaccine requires a 21-day interval between the 2 doses, and Moderna requires 28-day interval. Pfizer requires ultra cold storage, which makes the distribution chain even more challenging. However, the Moderna only requires the standard freezer storage. It's important to know that if you start with the Pfizer vaccine, your second dose also should be Pfizer. If you start with Moderna, the same holds true. You shouldn't, they operate in a way that in order to achieve that 95 or 94% effectiveness, you need doses from that vaccine. It's that brand of vaccine. It's also important to note that they are only approved, and I haven't checked this as of the headlines today, but the expectation is that they will only be approved for adults, meaning 18 years and older, because the vaccine trials did not include pediatrics. It's also important to remember that we have other vaccines in the queue reaching the final stages of the evaluation. So from a timeline perspective, we see that the FDA reviewed the Pfizer vaccine today. We anticipate the first distribution of this vaccine to be occurring very, very quickly next week. And then the Moderna vaccine will go through the FDA review. It will have to have a follow-up ACIP final approval. And then the first distribution of that vaccine will be the following week. Because there are so many people in the high risk category for COVID-19 vaccination, the CDC and ACIP and IDPH all agreed that the sub-prioritization outlined here is where our efforts should be focused on. So this first phase that we are about to embark in is actually phase 1A. So we are looking at healthcare personnel and long-term care facility residents only. That we anticipate, and we've been saying maybe up to 6 to 8 weeks. The state is also expanding that expectation, and they started with a couple weeks and now they're up to 4. I think probably it will take us 6 to 8 weeks to vaccinate this 1A population, and not because we don't have the distribution or the vaccination plans in place, but rather it is due to the limited amount of vaccine that will be available to us. As phase 1A rolls out, then we will move into the 1B and 1C categories, and you can see who's involved in those 2 phases. So these numbers in the left-hand table are federal, national numbers. Healthcare personnel are considered to be all of those individuals listed in that category. That is where local public health in Illinois will be focusing our efforts, because the federal government has engaged with two pharmacy giants, CVS and Walgreens, to go into long-term care facilities and provide residents and staff with the vaccine. So we will be spending and focusing our efforts on the estimated 58,000 individuals who are in DuPage County who meet the healthcare personnel definition in these initial weeks. The program that CDC is using to administer to long-term care facilities is called the Pharmacy Partnership Program, and they will be addressing, as I said, our long-term care facilities and the staff that are in those long-term care facilities in order to get them immunized. Next slide. So we are in the first wave of the vaccine distribution in DuPage County, because the state of Illinois determined that with the limited supplies that they would be receiving for this first week, that they would focus those limited resources on the top 50 counties with the highest death rates per capita. Again, not a list that we wanted to be on, but it is in fact one that we're on. We know that the vaccine will be shipped from the manufacturer to our regional hospital coordinating center. Our EMS region is the hospital for this region is the Loyola University Medical Center in Maywood. IDPH has actually determined and will continue to determine the initial and ongoing allocations for DuPage County. We will be responsible for then coordinating the transport of the vaccines to our local health system partners. We know the first week of this vaccine distribution, the entire state is receiving about 109,000. A certain number goes to about 23,000 goes to Chicago, and the remainder is split up across the state. Our regional allocation is 16,575. And since DuPage County makes up the primary footprint of our region, we will receive almost all of those doses, 13,170 doses of the vaccine in week 1. We are finalizing our initial allocation plans. We know that not every healthcare worker is part of a healthcare system. We know that EMS providers are not formally part of a healthcare system, at least as far as these vaccination efforts are being considered at this point. And so we are finalizing, as I said, our plans for point of dispensing or pod locations. Our prior efforts and planning assumptions for these pods and for really touching 1 million or all of our residents at one time, it consisted of, bringing large groups of individuals together. We talked a lot about the Cipro and doxycycline, if that was going to be, if it was going to be more of a antibiotic or prophylaxis kind of event. But what we're faced with now is something that doesn't fit into those plans. So we will be using a drive-through medical model, meaning that we will have to touch every single person who is receiving this medical countermeasure. We know it needs to be drive-through or carefully orchestrated in large outdoor places because of the level of disease activity. And we know that this will not be an opportunity, again, unique from what we experienced for H1N1, where we saw large numbers of family groups coming and getting immunized all at one time. That will not be possible either. A lot of information is still rapidly developing. It is an extraordinarily fluid situation. We don't have any idea of what our week 2, 3, or 4 and ongoing allocation will be for vaccine. What we do know is to expect, and what we've been told to prepare for, is weekly allocation of vaccine. One of the key concerns that we have had from the very beginning of talk of vaccines for H1N1 is the vaccine safety and making sure that feedback on side effects and adverse events are reported. And so that will be another focus of our work as we roll this out. So not only will we have information on our website and in other places where people can be comfortable in submitting their experiences, but we will also have this information. And I think it's very important for those of you in the medical field, you're very familiar with the VAERS system. It's a national vaccine safety surveillance program that has been in existence for years and years. It serves as a very robust early warning system to detect possible safety issues by collecting information from adverse events from across everyone who is being immunized. It is a centralized national registry of these types of events. We have already launched our public information site on vaccine. As more information becomes available, this is where we will be putting that information. Again, we encourage people to check back frequently for local updates. And I think that's all I have for my presentation. So questions?
Any questions of Karen?
I have a quick question on how you're going to pay for all of this when most of the immunizing is going to take place after 12:30.
That is a very good question. Again, today we learned that the federal efforts to come to some sort of compromise for this mass vaccination plan have once again fallen through. Now, the vaccine and the supplies themselves are provided to us through the federal government and distributed through IDPH. So the costs for those are put to the side. However, the cost for the staffing to actually get the vaccine into people's arms will be borne by local health departments. And so we have been looking at ways to, maximize our internal resources, find creative ways of partnering with fourth-year nursing students and others to provide these immunizations to people. Well, we kind of I don't think it's that the federal government won't provide financial relief for this. I just don't know if it will be immediately available to us. In addition, we have had initial conversations with both county and state officials about, if federal dollars are available, how will those be distributed? we're very much advocating for a per capita kind of formula from the state for vaccine efforts to avoid the underfunding of the DuPage County Health Department that we saw for our contact tracing and case investigation efforts. So we're kind of playing zone defense and offense all at the same time.
Karen, I have a question. I think the health departments, the local health departments are to me, obviously the best qualified to handle the vaccine. But was that a dictate by the federal government, by IDPH? I mean, why is the health department responsible to do this as opposed to these vaccines going to Loyola and then being shipped to the various hospitals for dispensing?
Yeah, that's a really good question. And it seems like kind of haven't we done enough already? However, local health departments have the infrastructure and the capacity and the expertise of managing vaccine efforts, large vaccine efforts like this. So that's where Illinois, and I'm assuming most states, have really looked to find that. Things as simple as, you know, how to transport vaccine and how to make sure that as it's being stored, that we have temp tracing and monitor the effectiveness of the vaccine before it gets to people's arms. We certainly are not looking at us being the only ones to do these vaccinations. However, particularly for this first round, the vast majority, all of the doses going to our health system partners will be provided to their staff by their staff. And so we will pick up individuals who don't have access that way, but meet that 1A criteria.
And my second question is somewhat more patriarchal in terms of trying to make sure that we get taken care of here in DuPage County. Were the vaccines that were dispensed and given to DuPage County, was this done on a per capita basis? Was this done based on, especially for the first round, for the 1A, was it given based on how many long-term people we had in long-term care facilities and how many healthcare providers? How did we get the allocation of the 16,000 versus some other number as opposed to other counties?
Chris, can you go into that a little bit?
Yeah, so 50 of the 102 counties in Illinois were set up for distribution in the first round, and that was based on the 50 counties with the highest per capita death rates through the COVID pandemic. So that was kind of the first cut. And then I don't know exactly, we don't know how the state then divided up those vaccines. There was some consideration for population. Obviously, DuPage and Cook County and Lake are getting our higher quantities, but we don't know the exact formula. But it is the first 50 counties, the counties with the 50 top death rates in that initial round of shipping, and then some consideration for population numbers within those.
Okay, and I'm sorry to be asking these questions, which are way down the road, but people have asked them of me. Let's assume after the first round, after the 16,000 is done, we still have people to vaccinate who are in the 1A category. But another county has taken care of all their 1A people. Is the next group of vaccines that come in going to go to us to finish up the 1A group before another county gets to go to the 1B group? Do you understand my question?
Oh, absolutely. And I think it's a very good question. And those are the concerns that we have in this part of the state that are not shared by some of our southern neighbors. or, more remote neighbors. I do not believe I have heard an answer for that specific question.
Okay,
This is Robert Spadoni. Yeah, I also sit on these vaccination calls for, depending on which one, not DuPage County all the time, but Cook County, and we're obviously getting our allocation from Loyola. I think the thought is obviously the first one got approved today, Pfizer. It'll probably get finally approved on Sunday with distribution sometime next week. But Moderna, the second one, is supposed to be approved in the next 2 weeks or so. And their way they're manufactured is they've manufactured many more than Pfizer has. And when they're both able to distribute throughout the country, the vaccines, there'll be an extra 12 million doses available, I think, on a 2-week basis and all that. So the plan, as what we have right now, is based on one manufacturer and being able to provide that vaccination. Once the second one comes in, then, I think they're going to redistribute, figuring out how they're doing that. And then when the third one gets approved, it might be about another 30 days out. It'll be, again, a redistribution of how that plays out. It's a very sticky situation, same as you pointed out, or whoever asked, is what happens if everybody did 1A? Can you go to 2 and somewhere else? They haven't really given a great answer on that one yet.
Okay.
At least that calls I've been on.
Okay, thanks.
Yeah, and although we look at these in these very discrete categories, there are people who are healthcare workers who also are over 65 and potentially people with chronic health conditions. So, we're envisioning and planning in these distinct buckets, but in fact, I think it will be far messier than that as we roll this out.
Okay, any other questions of Karen? Okay, well, thank you, Karen. Keep up the great work. You guys are doing amazing stuff, and it's very exciting. And get some rest tonight, because you guys are in for a lot more work in the days and weeks and months to come, but we certainly appreciate it. All right, moving on to the point on the agenda known as public comment. This is an opportunity for the public to comment on items of interest to the health department. Customarily, we would have people in person at our meetings, but given the fact that we are not able, we're going to switch it over to Chris, I think, is going to take the next half hour. And maybe we'll take people need a 5-minute break or something, and then we'll go into the second one. I'm trying to do the math here, but if each one of these is a minute and we have 225, figure it out. So I'm not going to try to think that far ahead, but maybe we can move a little bit quicker. But I ask all of you to give Penny and Chris your indulgence and stay with us. It's terribly important to listen to what people have to say, and hopefully they will.
It'll actually be Adam that'll be reading.
I'm sorry, Adam. Okay, I apologize. So it's
No problem.
Penny and Adam. Adam's got the more baritone voice anyhow, so that's
Okay. Comment. Curious Savnago Wheaton. I would like my name to be read into the meeting attendance record. I am working on my master's degree in public health and epidemiology, and I'm attending this meeting for a class. Comment. Rebecca Harpster, Elmhurst, the DuPage County Health Department return to school framework needs to be updated for the current CDC guidance that kids should be in school in person. Even though you have a disclaimer that's up to each individual school district and superintendent, it's difficult for a superintendent to make a decision that does not follow health department guidance. The CDC says that kids should be in school regardless of community transmission, and in times of high community transmission, schools should follow 5 mitigations of 1, mask wearing, 2, hand washing, 3, cleaning and disinfecting, 4 healthy hygiene habits covering coughs and sneezes and washing hands afterwards, and 5 contact tracing with local health departments. Please change your return to school guidance to reflect the data that schools are not super spreader events and our safest place for children to be. The health, safety, and education of an entire generation rests on your shoulders. Take action now. Comment, Lindsay Burrell, Hurst, please reconsider your health department's policy on remote schooling. These children are suffering mentally and falling more and more behind learning remotely. Schools are not super spreaders, and with proper cleaning and cleanliness, they can learn in person safely. Please make it so the kids that want to go back in person can do so. It's their right to have free and equal education. Comment, Catherine Have, Elmhurst, the DuPage County Health Department's return to school framework needs to be updated for the current CDC guidance that kids should be in school in person. The CDC says that kids should be in school regardless of community transmission, and in times of high community transmission, schools should follow 5 mitigations of 1, mask wearing, 2, hand washing, 3, cleaning and disinfectant, 4, healthy hygiene habits, covering coughs and sneezes and washing hands afterwards, and 5, contact tracing with local health departments. Please change your return to school guidance to reflect the data that schools are not super spreader events and are the safest place for children to be. The health, safety, and education of an entire generation rests on your shoulders. Comment, Marie Scotty, Elmhurst, this is an emergency. These kids need to be in school. Return to school framework needs to be updated for the current CDC guidance. The kids should be in school in person. Even though you have a disclaimer, it's up to you, each individual school district and superintendent. It's difficult for superintendent to make a decision that does not follow health department guidelines. The CDC says that kids should be in school regardless of community transmission, and in time of high community transmission, schools should follow the 5 mitigations of 1, mask wearing, 2, hand washing, 3, cleaning and disinfecting, 4, healthy hygiene habits covering coughs and sneezes and washing hands afterward, and 5, contact tracing with local health departments. Please change your return to school guidance to reflect the data that schools are not super spreader events and are the safest place for children to be. The health, safety, and education of an entire generation rests on your shoulders. Take action now. Comment, Beth Zimmer, Elmhurst, data and science have clearly shown that schools can be open safely. Please update the health department guidance to recommend in-person learning for our children. Comment, Nirali Gia, Elmhurst, please get our kids back in school. CDC is strongly urging in-person teaching. Schools should be the last to close. Private schools throughout Elmhurst are in person successfully. Teachers are essential workers, just like I am. Provide them with safety equipment, do COVID tests in the school, provide plexiglass barriers, have school pods. Our kids need to be in school in person. Comment, Greg Lind, Elmhurst, it is time to get our children back in school. Do whatever you have to do with your metrics to say kids should be in the classroom. Mental health issues and suicide should be your bigger concern versus the COVID. The lack of science and the political claims of Governor Pritzker has done long-term damage to our kids. Get our kids back in school. Comment, Amy Wellman, Elmhurst, the DuPage County Health Department's return to school framework needs to be updated for the current CDC guidance that kids should be in school in person. The CDC says that kids should be in school regardless of community transmission, and in times of high community transmission, schools should follow 5 mitigations of 1, mask wearing, 2, hand washing, 3, cleaning and disinfecting, 4, healthy hygiene habits covering coughs and sneezes and washing hands afterwards, and 5, contact tracing with local health departments. Please change your return to school guidance to reflect the data that schools are not super spreader events and are the safest place for children to be. The health, safety, and education of an entire generation rests on your shoulders. Take action now. Comment, Tracy Wilcox, please reconsider the metrics being used to guide return to school for our children. Multiple studies have shown limited transmission in schools despite high community numbers. Our kids need to be in school. Comment, Aaron Solis, Elmhurst, the health department should be considering all of the studies that show schools are not super spreader events and that they are safer than the community at large. Comment, Laura Pisker, Elmhurst, please open school for in-person learning. Schools are not super spreaders. Children need to be in school for their mental and emotional health. Remote learning is not working. Please change your health department school metrics to allow for imperial learning now. Comment, Tracy Stewart, Elmhurst, your DuPage County Health. As a parent of 3 school-age children in DuPage County, I implore you to please reconsider your health department's recommendation for remote schooling. In-person learning is absolutely essential to our children. Remote learning is failing and is actually harming them. They need in-person instruction for their health and well-being. Please have your health department consider recommending that schools be in person. Schools are not super spreader events when proper mitigations such as mask, hand washing, and distancing are taking place. Please change your health department school metrics to allow for in-person. Sincerely, Tracy. Comment, Tricia Pusak, Elmhurst, please change your guidance regarding in-person schooling in the county. Many public schools remain fully remote, despite the fact that statistics show schools are not spreading the virus and children are at least amount of risk. The actual harm mentally and physically in children and parents being caused by the current remote learning curriculum far outweighs any potential harm of the virus. There are safety measures in place at the schools, and in-person learning is essential. Comment, Katie Marshall. I am asking you to change your return to school framework to say that kids should be in school regardless of community transmission. And in the case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning, and disinfecting, healthy hygiene, and contact tracing. The website also says that school districts and superintendents can make their own decisions, but it's very difficult for a school to go against the guidance from the health department. The health department should be considering all of the studies that show schools are not super spreader events and that they are safer than the community. Michelle Chavez, Elmhurst, please change your criteria so our kids can go back to in-person, to go back and learn in person. I am worried about my child's mental health. In-person learning is essential to the health development of young people in our county. Please have your health department consider recommending that schools be in person. Nora Evans, Elmhurst, please consider updating the DuPage County Health Department's return to school framework for the current CDC guidance that kids should be in school in person. Although you have a disclaimer that's up to each individual school district and superintendent, it's difficult for a superintendent to make a decision that does not follow health department guidance. The CDC states that kids should be in school regardless of community transmission, and in times of high community transmission, schools should follow 5 mitigations of 1, mask wearing, 2, hand washing, 3, cleaning and disinfecting, 4, healthy hygiene habits, covering coughs, sneezes, and washing hands afterwards, and 5, contact tracing with local health departments. Please update the return to school framework to reflect the data that schools are not super spreader events and are the safest place for children to be. Thank you for your consideration. Comment, Deepa Leo, Elmhurst, please reconsider your stance on sending kids back to school. Our kids are suffering, our community is suffering. Comment, Robin Pretzi, Elmhurst, good evening. I'm writing to ask you to please change your return to school guidance to reflect the data that schools are not super spreaders and are actually the safest place for our children to be right now. Please change your health department school metrics to allow for in-person schooling now. District 205 kids have been learning strictly through a computer screen for 8 months now, minus a week or 2 of learning that didn't last. These kids cannot continue to learn this way. We are hurting our children in more ways than one. Please help us get them back into the classroom where they belong. Thank you for your consideration. Comment, Lisa Postak, Elmhurst. The DuPage County Health Department return to school framework needs to be updated for the current CDC guidance that kids should be in school, even though you have a disclaimer that it's up to each individual school superintendent each individual school district and superintendent. It's difficult for a superintendent to make a decision that does not follow health department guidance. The CDC says that kids should be in school regardless of community transmission, and in times of high community transmission, schools should follow 5 mitigations of 1, mask wearing, 2, hand washing, 3, cleaning and disinfecting, 4, healthy hygiene habits, covering coughs and sneezes and washing hands afterwards, and 5, contact tracing with local health departments. Please change your return to school guidance to reflect the data that schools are not super spreader events and are the safest place for children to be. The health, safety, and education of an entire generation rests on your shoulders. Kate Sabramina, Elmhurst, please change your health department school recommendations so that you are recommending in-person school. Our children are suffering so very much. My 3 children would greatly benefit from in-person school. One has an IEP and is unable to learn remotely, so is more behind now. One cries every day. One is seriously depressed. Please help. We all know that schools are not super spreader events. With mitigations such as masks, hand washing, and distance indoors, we can safely keep our schools open and save what is left of the school year for our most vulnerable. Comment, Gail Hess, Elmhurst, please reconsider your health department's recommendation for remote schooling. In-person learning is essential to the health department development of young people in our county. Please have your health department consider recommending that school be in person. My kids are suffering and regressing backwards because they are not in school. Please change your health department school metrics to allow for in-person schooling now. Comment, Colleen Tinch. Please have your health department consider recommending that schools be in person. Schools are not super spreader events when proper mitigations such as masks and hand washing are taking place. Thank you. Comment, Brent Connell, Elmhurst. I urge this organization to reconsider its stance on in-person learning. Proper precautions can take place to keep everyone reasonably safe. Physical interaction is critical for our children's well-being, both in the short term and long term. Comment, Lisa O'Connor, Elmhurst, please reconsider your health department's recommendation for remote schooling. In-person learning is essential to the health and development of young people in our county. Please have your health department consider recommending that schools be in person. Schools are not super spreader events when proper mitigation such as masks and hand washing are taking place. Please change your health department school metrics to allow for in-person schooling now. Comment, Carrie Martin, Elmhurst, our schools should be in person at school. our children should be in person at school. In-person learning is essential to our children's health and development. Recent research, COVID-19 data, and expert recommendations from the CDC, WHO, academic community clearly supports this. The data shows schools are not super spreaders and are safe. Transmissions in schools is not directly linked to community spread. Please reconsider your framework for opening schools for in-person learning to reflect the most recent research and data and help our children in DuPage County get back to in-person learning. Comment, Tara O'Donnell, Elmhurst, return to school framework needs to be updated for the current CDC guidance that kids should be in school in person full time. Even though you have a disclaimer that it's up to each individual school district and superintendent, it's difficult for a superintendent to make a decision that does not follow health department guidance. The CDC says that kids should be in school regardless of community transmission. And in times of the high community transmission, schools should follow 5 mitigations of 1, mask wearing, 2, hand washing, 3, cleaning and disinfecting, 4, healthy hygiene habits covering coughs and sneezes and washing hands afterwards, and 5, contact tracing with local health departments. Please change your return to school guidance to reflect the data that schools are not super spreader events and are the safest place for children to be. The health, safety, and education of an entire generation rests on your shoulders. Take action. Stop being political. Do better. Comment, Dana Van Sleet, Elmhurst. The DuPage County Health Department return to school framework needs to be updated for the current CDC guidance that kids should be in school in person. Even though you have a disclaimer that it's up to each individual school district and superintendent, they're using your information and guidance as a resource for their decisions. The CDC says that kids should be in school regardless of community transmission, and in times of high community transmission, schools should follow 5 mitigations of 1, mask wearing, 2, hand washing, 3, cleaning and disinfecting, 4, healthy hygiene habits covering coughs and sneezes and washing hands afterwards, and 5, contact tracing with local health departments. Please change your return to school guidance to reflect the data that schools are not super spreader events if they follow the mitigations listed above, and schools should make every attempt to open up to in-person learning. The health and education of the children in our county depend on it. Comment, Rose Giovanelli, Elmhurst. The DuPage County Health Department's return to school framework needs to be updated for the current CDC guidance that kids should be in school in person. Even though you have a disclaimer that it's up to each individual school district and superintendent, it's difficult for a superintendent to make a decision that does not follow health department guidance. The CDC says that kids should be in school regardless of community transmission, and in times of high community transmission, schools should follow 5 mitigations of 1, mask wearing, 2, hand washing, 3, cleaning and disinfecting, 4, healthy hygiene habits covering coughs and sneezes and washing hands afterwards, and 5, contact tracing with local health departments. Please change your return to school guidance to reflect the data that schools are not super spreader events and are the safest place for children to be. The health, safety, and education of an entire generation rests on your shoulders. Take action now. Comment, Jamie Schwager, Elmhurst. Schools are not super spreader events when the proper mitigations such as mask, hand washing are taking place. Please change your health department school metrics to allow for in-person schooling now. Kids need to be in school and are missing out on valuable learning time. Even though you have a disclaimer that it's up to each individual school district and superintendent, it's difficult for a superintendent to make a decision that does not follow health department guidance. The CDC says that kids should be in school regardless of community transmission, and in times of high community transmission, schools should follow 5 mitigations of 1, mask wearing, 2, hand washing, 3, cleaning and disinfecting, 4, healthy hygiene habits, and 5, contact tracing with local health departments. The health, safety, and education of an entire generation rests on your shoulders. Please take action now. Kids need to be in school. Adam.
Comment, Megan Howergan, Elmhurst. Schools are not super spreader events, especially when proper mitigations are taking place. Please change your health department recommendations for school metrics to allow for in-person learning now. Thank you. Comment, Laura Branding, Elmhurst. Your recommendation for remote schooling needs to be updated to reflect current CDC and public health officials who are recommending that children be in school in person full time, even though you have a disclaimer that it's up to each individual school district and superintendent. It's difficult for a superintendent to make a decision that does not follow health department guidance. The CDC says that kids should be in school regardless of community transmission. And in times of high community transmission, schools should follow 5 mitigations of 1, mask wearing, 2, hand washing, 3, cleaning and disinfecting, 4, healthy hygiene habits covering coughs and sneezes and washing hands afterwards, and 5, contact tracing with local health departments. Please change your return to school guidance to reflect the data. The school are the safest place for children to be. The health, safety, and education of an entire generation rests on your shoulders. Take action now. Comment, Mia Allen, Elmhurst. The DuPage County Health Department's return to school framework needs to be updated for the current CDC guidance that kids should be in school in person, even though you have a disclaimer that it's up to each individual school district and superintendent. It's difficult for a superintendent to make a decision that does not follow health department guidance. The CDC says the kids should be in school regardless of community transmission, and in times of high community transmission, schools should follow 5 mitigations of 1, mask wearing, 2, hand washing, 3, cleaning and disinfecting, 4, healthy hygiene habits covering coughs and sneezes and washing hands afterwards, and 5, contact tracing with local health departments. Please change your return to school guidance to reflect the data that schools are not super spreader events and are the safest place for children to be. The health, safety, and education of an entire generation rests on your shoulders. Take action. Comment, Nicole Coletta, Elmhurst. Schools are not super spreader events when proper mitigation such as masks and hand washing are taking place. Please change your health department school metrics to allow for full-time in-person schooling now. Comment, Carla Cannon, Elmhurst. Please look to change your return to school framework. Kids should be in school regardless of community transmission. And in case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning, and disinfecting, healthy hygiene, and contact tracing. Please consider all of the studies that show schools are not super spreader events and that they are safer than the community at large. Private schools have been in-person teaching and have not had serious consequences. Our kids need to be in school. Comment, Melissa Rieger. Please consider opening schools with proper safety precautions. It is possible for in-person learning. Schools are not considered super spreaders. Mentally and socially, my kids are struggling and need interaction with other kids and teachers. They are not getting a proper education through just the computer and will struggle in future years. Comment, Jody Leonard, Elmhurst. In-person learning is essential to the healthy development of school children, pre-K through high school in our country. Please have your health department consider recommending all school attendance be in person. We are causing far more damage to the social and mental well-being of these children by isolating them from their peers, mentors, and regular daily routine. Comment, Michelle Barclay, Elmhurst. In-person learning is essential for our kids' education and most important, their mental state. Please change the metrics so our students can return to school in person immediately. Comment, Lisa Baugren. Please reconsider the health department's recommendation for remote schooling. In-person learning is essential to the healthy development of young people in our county, and the health department should consider recommending that schools apply more specific data and criteria when evaluating whether in-person instruction is safe. For example, building specific data. As shown in numerous studies, schools are not super spreader places or events when proper mitigations such as masks and hand washing are taking place. Our district is holding these county-wide standards against our children. Comment, Connie Smith. I am begging you to change your return to school framework. Kids of all ages need to be in school. This has gone on long enough. Our high school is one of the only ones in DuPage County that has not been back in the building since March. Our superintendent will not budge until you change your criteria. There's no reason these kids cannot be back in the building. There are schools twice our size doing it, but because our superintendent and school board think guidelines mean follow or else, he will not allow any kids in school. Enough is enough. These kids have to get back to school. Please, this is not fair to these kids. Thank you. Comment, Jeanette Lancelotti, Elmhurst. I'm asking DuPage County Health to change their return to school framework to say that kids should be in school regardless of community transmission. And in case of high community, it's very difficult for a school district to go against the guidance from the health department. The health department should be considering all of the studies that show schools are not super spreader events and that they are safer than the community at large. Please recommend that students return to in-person learning and use local metrics. Comment, Jennifer Dabrowski, Elmhurst. There is a meeting of please change the return to school framework to say that kids should be in school regardless of community transmission. And in case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene, and contact tracing. Comment, John Naughton Lombard. Please separate COVID cases and fatalities by age group and reconsider the return to school framework to separate long-term care facility data from the general population, as this is a closed group. Studies show that schools are not super spreaders. No person under the age of 20 has died from COVID-19, yet the matrix still shows it is not safe to return. Please look beyond cases when updating the school framework criteria. Thank you. Comment, Beth Plummer, Elmhurst. Please reconsider your health department's recommendation for remote learning. Comment, Elizabeth Thompson, Elmhurst. I am a pediatrician and mom of 5. I'm writing to request the DuPage County Board adapt their metrics and recommendations for children to return in-person learning. There is growing evidence that schools with mitigation measures of masks and distancing are safe. Please consider metrics that prioritize school-based data as opposed to community spread. Our children are suffering both academically and from a social emotional standpoint. They need in-person education, and this should be considered an essential service in our communities. The AAP and many other authorities on children's health feel that in-person education is necessary and needs to be prioritized now. Comment, Michelle Turner, Elmhurst. Our children need in-person learning. Please reconsider the metric used. In-person learning is essential to the healthy development of our children at all levels. Comment, Liz Haywood, Elmhurst. Please reconsider the county's recommendation on remote schooling. In-person learning is essential for the health of our young population, and an overwhelming majority of healthcare professionals support schools remaining open. Thank you. Comment, Linda Wilkie, Villa Park. Please reconsider and get this kids back to school. This has gone on too long for political gain. If other states can go to school and have athletics, the kids of Illinois should be able to as well. The suicide and substance rate is very high because of this. People are broke because of the restrictions. This is one of the smartest viruses known. It's amazing how it's hard hitting in restaurants, bars, schools, but not big box. It's time to put the kids first. Also, can we report just COVID only cases and not with other illnesses? And can we start reporting the survival rate? Comment, Kim Ancilus, Elmhurst. Please reconsider your recommendation for remote learning. In-person learning is essential to the healthy development of young people in our county. Our children's education is suffering, as well as their social and emotional well-being. They need to be back in school ASAP. Comment, Janet Doherty. Please review the data of schools that have been opened and recommend in-person learning. Remote learning is inadequate. Comment, Debbie Kogan, Elmhurst. Please reconsider the metrics you are using to keep our kids out of school. We need to find some balance here. Our current situation is not helping anyone and the kids are suffering the most. Thank you. Comment, Sheila Mueller, Elmhurst. Please change the health metrics to get our children back to school. Very disappointed with District 205 in DuPage County. Our children's mental and educational health is being affected by these metrics. Get our kids back to school in person. There are methods to do this safely, especially 8+ months into COVID. Comment, PM Lind, Elmhurst. Please consider the research and CDC guidance. The kids are not super spreader events and the safest place for them is in school. Kids are killing themselves because schools are closed. Public health includes mental health. We must act as a community to open schools, and they provided a link. Comment, Greg Lind, Elmhurst. It is time for DuPage County to change their metrics to get our kids back in school. The teen suicides and mental health issues associated with school closing is far more deadly than COVID-19. Part of this is very political. When Obama was in office, the H1N1 infected more people than COVID. No school closures or shutdowns were mandated. Because our incompetent governor does not like President Trump, the county and the governor are dreaming up numbers to meet your political agenda. The CDC has said kids belong in school and it is safer in school for our kids regardless of your metrics. We need you to recommend kids in school versus remote. 26% increase in mental health is bigger than any COVID outbreak for kids. This is on the county. Get our kids back in school now, follow science, and open the schools. Comment, Bonnie Procadlo. Our kids need to be in school. They are suffering so much emotionally, socially, and intellectually. With the proper precautions, schools are safe places to be. Please change your health department school metrics to allow for in-person schooling as soon as possible. Thank you for your time. Comment, Mary Jo Hecker, Elmhurst. I know that many Elmhurst 205 parents are submitting comments to plead for students to return to school full-time in January. However, I am a school nurse in this district, and I can tell you that myself, my nursing colleagues, and other staff members who work in the school buildings are uncomfortable with that at this time. We were on a hybrid schedule in the fall, and we were able to keep our students safe by having smaller class sizes, less kids on the buses, and a shorter school day with no lunch. With the numbers of students that are enrolled at our schools, we will not be able to safely control social distancing. The buses, the classrooms, the lunchrooms, and the hallways can be crowded, and there would be the chances of increased exposure to COVID-19. I can tell you that we are all concerned with the potential of more students in all age groups either being potentially asymptomatic carriers or actually coming to school sick with symptoms. Hybrid is our best option for January. Comment, Natalie Smith, Elmhurst. Full in-person learning is essential for the development of young children. Please reconsider your health department's recommendation for remote learning. Our children need to be learning in person with the teacher and their peers. Comment, Sarah Dixon, Elmhurst. In-person learning is essential to the healthy development of our youth. Please have your health department consider recommending that schools be in person. School districts are not making the right choice for our kids. They are needlessly suffering. Comment, Tina Siegler, Villa Park. Please reconsider your health department's recommendation for remote schooling. In-person learning is essential to the healthy development of young people in our county. Schools are not super spreader events when proper mitigation such as masks and hand washing are taking place. Please change your health department school metrics to allow for in-person schooling now. Numerous school districts, private and public, have been open for months without health issues. This needs to be allowed for all districts. Our kids are suffering mentally. Penny.
Comment, Jennifer Compensone, Elmhurst, depression, suicide. This is what I am worried about, not COVID. Kids are not dying from COVID. Young people are not dying from COVID. 10 months since the kids in Elmhurst went to school. I'd guess more than half the kids I have known have had it already. No one was even sick. But for 10 months, we've been told to keep them in our houses. Don't let them out with friends. Don't open schools. 10 months. These kids are suffering and lonely. Comment, Tricia Fisher. In-person learning is essential to the healthy development of young people in our county. This is more than just academics. It's about social and emotional development, which is critical in the early years of school to set the tone for a lifetime of success. Please reconsider your recommendation for in-person schools. States and countries all over the world have shown full-time in-person school can be done safely and even among private schools in our own county. Comment, Terry Ko, Elmhurst, please change your metrics, a message so we can reopen schools now. Schools are not super spreaders when mitigation is in place. Comment, Connie Horwitz, Lombard, please reconsider your current metrics for returning our children to school. There is proof from respected world-renowned doctors that in-person learning is not the cause of spreading COVID. School District 88 here in DuPage is basing their back to school plan solely on your metrics, which does not accurately reflect our neighborhood. My children are suffering and have been e-learning since March. We must do better for these kids. Thank you for your consideration. Comment, Michelle Schultz, Aurora. Good morning. I am asking the DuPage County Health Department to reconsider the recommended return to school metrics currently in place. We know in-person learning isn't causing the spread of COVID, and science and doctors are very clear that children should be in school. Thanks for your help. Thank you, Michelle Schultz, District 204 family. Comment, Jackie Bragg, Bolingbrook. It's time to send our children back to school. Enough is enough. For the parents who want to keep their children home, they can homeschool. The majority rules, and kids and parents want the schools to open back up. Comment, Susan Flynn, Naperville, get the kids back to school. Comment, Mark Rising, Aurora, as a resident and school board member of DuPage, please take away the designation of strongly recommend online learning. It is extremely difficult to try to open schools with this designation. Instead, the guidance should be for schools to monitor their own local metrics and even at school building by school building basis. Will and King County are being less restrictive and allowing school districts to make their own decisions safely, as we know it can be done safely. Today, no transmission of COVID-19 has been spread when safety protocols were followed. Please consider being less rigid and restrictive and leave those decisions up to local school districts, as Pritzker and Fauci say we should be allowed to. Your current guidance, as we are directed to and should follow, not allowing us to do so. Comment, Rebecca Hamilton, Naperville, please reconsider your metrics for allowing in-person learning in schools. The CDC has acknowledged that there's very little spread of COVID-19 in schools. The CDC has also acknowledged that keeping students at home is more harmful to their health and overall well-being than being in school. Comment, Nicole Picarek, Naperville, please reconsider your suggested return to learn guidance. Our little kids need to return to full in-person learning ASAP. Most of our country is successfully going to school in person. We need to get ours in too. Thank you. Comment, Sandra Laxner, Winfield, send kids back to school. Comment, Natalie Owen, Naperville, please recommend the schools open ASAP. The mental health of my family is at risk. We need a school learning environment and kids need a break from their parents. We have hands-on learners in this house and the kids and teachers have Zoom fatigue. Please put the kids first and get them back to school now. Comment, Brandy Mintz, Lombard, I am writing begging you to change your return to school guidelines, at least for elementary age children. Our superintendent is hiding behind your guidelines set, even while all districts around us have hybrid models set up and running effectively. Hopefully the health department could be considering all of these studies that show schools are not super spreader events and that they are safe. Comment, Kristen Milani, per countless doctors, children belong in school. Your metrics need to be reconsidered to allow for this. Keeping kids out until there are 0 cases is unattainable. Schools need workable solutions, not your strict guidelines. Kids need to come first here, and everyone is ignoring their needs. Comment, Tim Doyle, Aurora, reopen the schools. We are hurting our kids and ignoring data that says schools are not the problem. Comment, Stephanie Fritz, please reconsider your recommended return to school metrics. Parents need a choice of whether to send their schools to school or keep them remote. Other districts, private schools, and other states have figured out something that works for them. I don't understand how one of the best districts in the area hasn't been let to figure something out in almost a year. District 204 has some very high taxes with a lesser plan. Comment, Kelly Carpenter, Elmhurst, please reconsider your health department's recommendation for remote schooling. In-person learning is essential to the healthy development of young people, especially elementary school in our county. Please have your health department reconsider recommending that please have your health department consider recommending that schools be in person. Schools are not super spreader events where proper mitigation such as masks and hand washing are taking place. Please change your health department school metrics to allow for in-person schooling now for full school days. Masks are mandatory. Comment, Elena Siak, Elmhurst, the DuPage County Health Department's return to school framework needs to be updated for the current CDC guidance that kids should be in school in person. Your disclaimer that it's up to each individual school district and superintendent makes it difficult for a superintendent to make a decision without outside pressure. The CDC says that kids should be in school regardless of community transmission, and in times of community transmission, schools should follow 5 mitigations of 1, mask wearing, 2, hand washing, 3, cleaning and disinfecting, 4, healthy hygiene habits, covering coughs and sneezes and washing hands afterwards, and 5, Contact tracing with local health departments. Please change your return to school guidance to reflect data that schools aren't super spreader events and are the safest place for children to be. The health, safety, and education of an entire generation rests on your shoulders. Don't allow our districts to hide behind your vague language any longer. Comment, Stephanie McVeigh, Aurora, please stop making these ridiculous parameters for remote learning. The governor says schools can be open. Dr. Fauci says schools can be open. The CDC and the Academy of Pediatrics say schools can be open. Yes, I am being told in District 204 that my child cannot go back to school because the district is following the DuPage health metrics. Please stop and consider what your guidance is doing to our children. Comment, Abby Favreau, Elmhurst, change your moronic guidelines and recommend kids be in school, full stop. Comment, Amy Lambrecht, Elmhurst, the DCHD return to school framework should be updated based on the current CDC guidance that kids need to be receiving in-person instruction. While there is a disclaimer allowing individual districts and superintendents to choose, going against the DuPage County Health Department is extremely difficult. The CDC states that kids need to be in school. The American Association of Pediatrics states kids should be in school. The loss of learning coupled with mental, emotional damage for kids needs to be weighed against the risk of in-person learning. The CDC says that kids should be in person regardless of community transmission. During times of community transmission, schools should follow mitigation plans as stated by the CDC. Please change your return to school guidance to reflect the data that schools are not spreaders and that they are necessary places for children to be. The health, safety, and education of a future generation depends on these decisions. Please take action. Comment, Monica Shaw, Elmhurst. I would like to emphasize the importance of in-school learning. We have seen successes in other schools near and far. We hear experts such as Dr. Fauci tell us that our children need to go to school. Their initial recommendations seemed to be based on a shorter term idea. At this point, my kids have had subpar education for 6 months. In March through May, they were learning 20% and now 70%. How is that acceptable? My 8th grader was disappointed. He had 5 days off during Thanksgiving. He loves school. Let's continue to foster this love. Recently, I saw a friend and his brother, 4th grade, on my 6th grader's Zoom. I asked what was going on and received this response. We're in a breakout room, and since no one can see us, XXX is playing games with his brother. They do this all the time. Teachers cannot be expected to monitor these situations since their hands are tied. These children have missed so many things. We've learned how to be safe. Let's use that and give these children an education. Comment, Doug Breimer, please adapt your stance on school reopening to reflect the worldwide studies and science, virtually all showing that schools can and should reopen. If you choose not to, please cite one or more pieces of research backing your own opinions. Comment, Jill Jarvis, Elmhurst, please reconsider your health department's recommendation and support in-person learning as essential to the healthy development of the young people in our county. The data proves that schools are not super spreader events when proper mitigation such as masks, hand washing, and appropriate social distancing when possible are taking place. Please change your health department school metrics to allow for in-person schooling now. Comment, Sarah Macco, Naperville. I support Naperville School Districts 203 and 204, providing a return to in-person learning option for our children as soon as possible. I encourage you to help schools to find safe options for return to school. Thank you. Comment, Jean Hogan, Elmhurst. Good afternoon. After my last public comment, I received correspondence from Dan Cronin saying that DCBH only gives guidelines to schools and it is up to the superintendent and the BOE to make the decision to learn in person or remotely. However, your website, metrics, and framework clearly state that you recommend remote learning, and thus our District 205 cannot go against your guidelines. Please remove your recommendation from your website or make it more clear to school districts that they can make the decision to open. Please change your return to school framework to say that kids should be in school regardless of community transmission, and in case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene, and contact tracing. At this point, DCBH is the reason our kids are not in school. Thank you, Jean Hogan. Comment, Jeffrey Meltzer. The recommendations currently in place for a return to in-class school for our students must be amended. There's no evidence nationwide of schools being super spreader locations. Cook County and many others throughout Illinois have higher COVID infection rates, yet almost all of the schools in those counties have been in class since September or are returning in the coming week after a short pause. Your inaccurate and draconian measures are causing extensive and unnecessary harm to our students. It's well past time to offer families that attend DuPage County schools a choice. Comment, Jennifer Gendris, Glenn Ellen. As an elected school board member and holding a master's degree in public health, I am urging you to change your return to school framework to recommend that students should be in school regardless of community transmission, as long as school safety measures such as masking, hand washing, cleaning, and disinfecting and healthy hygiene are in place. School districts have found it very difficult to go against the guidance from the health department, mainly from a legal liability standpoint. By your very own metrics kept from March, you have demonstrated that schools are not a significant source of transmission. There is a plethora of worldwide data that shows schools are not super spreader events and that they are safer than the community at large. The truth is, for kids K through 12, the safest place they can be from our perspective is to remain in school, said CDC Director Dr. Robert Redfield. Comment, Carol Graham, Naperville. Please reconsider that schools in District 204 should be open. Your recommendations weigh heavily into the school's decisions. It is imperative that 204 start to move forward with something for the kids to get back in person. Thank you. Comment, Kim Gustafson, Naperville. The children need to be back in school ASAP. The kids aren't affected, they don't transmit, and if teachers are afraid, hire new ones. Comment, Melissa Covert, Elmhurst. Please reconsider the health department's recommendation for remote learning. In-person learning is essential to the healthy development of our children. The numbers do not support the remote learning framework. Our kids are growing depressed, and at what cost? Schools are not super spreaders and deemed essential in most countries. Private schools have remained open and have done it right. We need schools reopened for the health and well-being of our students. This is heartbreaking when the numbers do not support schools to be closed or is spreading the virus. Please reconsider. We are begging you, Adam.
Comment, Jamie Covert, Elmhurst. Please reconsider the health department's recommendation for remote learning. In-person learning is essential to the healthy development of our children. The numbers do not support the remote learning framework. Our kids are growing depressed, and at what cost? Schools are not super spreaders and deemed essential in most countries. Private schools have remained open and have done it right. We need schools reopened for the health and well-being of our students. This is heartbreaking when the numbers do not support schools to be closed or as spreading the virus. Please reconsider. We are begging you. Comment, Jennifer Rosenberg, Elmhurst. Please reconsider the health department's recommendation for remote learning. In-person learning is essential to the healthy development of our children. The numbers do not support the remote learning framework. Our kids are growing depressed, and at what cost? Schools are not the super spreaders and deemed essential in most countries. Private schools have remained open and have done it right. We need schools reopened for the health and well-being of our students. This is heartbreaking when the numbers do not support schools to be closed or as spreading the virus. Please reconsider. We are begging you. Comment, Janice Covert, Elmhurst. Please reconsider your recommendation for remote learning. The numbers aren't there. Schools are not a super spreader and are essential for our kids' development and well-being. Our hands are tied in District 205 because of your recommendations for remote learning. We need our kids in schools. My 8-year-old told me he is a loser and has no friends and now hates life. Please, I'm begging you. Please help us get our kids back to school. Comment, Kristen Freeman, Elmhurst. Please reconsider the health department recommendation for remote learning. In-person learning is essential to the healthy development of our children. The numbers do not support the remote learning framework. Our kids are growing depressed and at what cost? Schools are not the super spreaders and deemed essential in most countries. Private schools have remained open and have done it right. We need schools reopened for the health and well-being of our students. This is heartbreaking when the numbers do not support schools to be closed or as spreading the virus. Comment, Heidi Baird, Elmhurst. Schools are not super spreader events when proper mitigation such as masks and hand washing are taking place. Please change your health department school metrics to allow for in-person schooling and athletics now. The devastating effect this is having on our children is unacceptable. Comment, Agnezika Bajorek Bartlett. Closing schools and other restrictions are harmful for kids more harmful for kids than the virus itself, all for an over 99% survival rate. We believe that during the COVID-19 pandemic, the United States has extracted an enormous sacrifice from its youngest citizens to protect the health of its oldest. Or the results of this decision analytical model suggest that the attempt to save lives by closing schools may not have resulted in a net savings when considering the potential harms associated with this intervention, and provided a link. Comment, Powell Bajorek Bartlett provided a link. It is critically important for our public health to open schools this fall, said CDC Director Dr. Robert R. Redfield. The CDC resources released today will help parents, teachers, and administrators make practical, safety-focused decisions as this school year begins. I know this has been a difficult time for our nation's families. School closures have disrupted normal ways of life for children and parents, and they have had negative health consequences on our youth. CDC is prepared to work with K-12 schools to safely reopen while protecting the most vulnerable. Data shows that children are not at-risk group for COVID-19, provided another link, and the World Health Organization states that asymptomatic transmission is extremely rare, provided another link. Keep the schools open. It is crucial for our children. Comment, Jessica Clark, Villa Park. On November 20th, 2020, the director of CDC states, the truth is, for kids K through 12, one of the safest places they can be from our perspective is to remain in school. He said Education Association leaders say Redfield said the CDC has newer data to rely on to help it make such claims. Today, there's extensive data that we've gathered over the last 2 to 3 months to confirm that K through 12 schools can operate with face-to-face learning, and they can do it safely and they can do it responsibly, he said. With that being said, the data on the DuPage County dashboard of transmission is clear as day that the schools should 100% be open. The true killer will be the mental health crisis we will have on our hands if we do not get them back into full-time in-person learning. Just alone at Lurie's Children's Hospital, they've seen a 50% increase in mental health related visits. These are alarming numbers. Staying remote will cause effects with permanent damage in multiple ways. Comment, Megan Jenkins, please change your guidelines to allow in-person learning despite community spread. The research clearly shows spread within schools is very minimal and children are at lower risk in the school environment. The social, emotional, physical, and academic negative impact on our children greatly outweighs the risk of in-person learning. Our kids need to stop being tortured with 5 hours of screen time confined to their bedrooms. Enough is enough. Comment, Jeanette Golk of Naperville. Please, for the benefit of all students, revise the guidelines for reopening schools. The benefits of in-person schooling have been widely publicized from not only the CDC, but many experts across the country. Our county's choice of verbiage and guidelines are providing a scapegoat for local school districts choosing to remain in a remote learning situation. Please adjust all recommendations and guidelines to support the residents' right to choose to be in person. Our children are suffering and need to be in school. Please support this in a clear and concise way. Thank you for your time. Comment, Lisa Patak, Elmhurst. Please reconsider the decision criteria for bringing students back to hybrid time in person. The data shows transmission of the COVID-19 virus is not happening in the school environment enough to be a concern. Our students' mental health and ability to learn will dramatically improve if they are in school. Even if cases are high in the area, kids, staff are not getting it from attending school. Comment, Kelly Hubbard Wheaton, please adjust your stance on having kids in schools. You should be encouraging it, not preventing it with the unfounded guidelines and regulations. The CDC recommends kids should be in school. They've reduced the quarantine period to 7 to 10 days. We must announce this change so teachers and kids can be in the classroom. The schools have gone far beyond the mitigation methods needed to protect the kids and teachers. Let those mitigations do their jobs and get kids back in school. Please look at TikTok, Instagram, Snapchat. These kids are not okay. Comment, Catherine Liebenow Wheaton. Please let our children go back to in-person learning at Wheaton North. I'm a teacher at a K-8 school, and we've been in person since August 17th, only going remote for a total of 9 days. The reason that our students have to quarantine at our school is mostly because of things that happen at home or social gatherings, not because of school. If I wanted to homeschool my own children, I would homeschool, but my children need to be in person. My oldest daughter's college was in person for the entire semester, and she learned so much. The school day for my own children is from 9 a.m. to 1:30 p.m. Periods last for 30 minutes, and some teachers are only teaching for 15. They're struggling to learn anything. They're discouraged and bored. They need social interaction and not from the screen. Please, please, please let the students in Wheaton go back to school in person. They can't keep going on like this. Comment, Christine Evans. Please support DuPage County school districts by encouraging them to open schools fully. It is safe for kids to be in school. The DCHD and IDPH are demanding unnecessary precautions when masks, washing hands, contact tracing, cleaning and disinfecting, and healthy hygiene are sufficient to keep kids and staff safe. Encourage the DCHD to support the superintendent, staff, and students returning to school full time. The emotional distress felt by our children is tragic and will have lifelong effects. The loss of education currently occurring is devastating. It is offensive that other districts, states, and private schools in Illinois are successfully teaching their students in person when DuPage County Public Schools will not. It is up to the districts to decide on opening, but the DC board could encourage and support both the DCHD and districts to work together to make it happen. The health of our children depends on it, and our leaders can provide that support. Comment, Kelly Asif Elmhurst. Please have the health department consider opening schools for in-person learning. So many children are struggling academically, socially, and emotionally. Comment, Jody Dunham, Glen Ellen. Please consider changing your return to school framework. Our children need to be in school. Schools have been proven to have low rates of transmission, and transmission rates are extremely low among children. Please remove your guideline that bases children being in school around community transmission when so often the transmission is in long-term care facilities. When schools are following mitigations of masks and spacing and sanitizing, it is unnecessary to keep these children from their right to an education. So many school districts are basing their return to school on your recommendations. You have an opportunity to free our children from subpar online schooling. Please make a decision with that in mind. Comment, Gianna Befero Elmhurst. Please consider changing the return to school framework. Kids should be in school regardless of community transmission, and in case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene, and contact tracing. Schools are essential and are necessary for the well-being of our children. Comment, Michael Hales, as you consider your health guidelines, it should be critical to find ways and metrics to allow kids to return to school. The school and the classroom have proven to be safe places for kids and teachers alike with very low instances of COVID, especially when proper mitigation such as masks and distancing are in place. On the contrary, the mental health consequences, reduced capacity in learning and absorption, and unstructured oversight for kids is having a much greater negative impact and should be considered as an alternative reality when making any decisions related to COVID precautions. The data is in, and it is time we recommend sending our kids back to school. Comment, Stacy Harvey, Glen Ellen, the return to school framework should be amended so that students are in school regardless of community transmission rates, given the overwhelming evidence of lack of significant spread in school-place settings. In a community with high positivity rates, mitigation efforts of masks, hand washing, cleaning, disinfecting, healthy hygiene, and contact tracing can and should be used to maintain healthy school environments. Students need to be back, and the data supports return to in-person regardless of community positivity rates. Comment, Stephanie Clark, Glen Ellen. I'm asking for you to change their return to school framework to say that kids should be in school regardless of community transmission. In the case of high community transmission, schools should follow contact tracing. While it is true that school districts and superintendents can make their own decisions, it's very difficult for a school district to go against the guidance from the health department. The health department should be considering all of the studies that show schools are not super spreader events and they are safer than the community at large. Comment, Jeannie Ives, Wheaton. I respectfully request that the DuPage County Health Board follow the science and promote instead of caution against in-person learning for school children. National experts from the CDC and other medical experts agree that children have extremely low risk of adverse reactions to COVID-19, that they are not super spreaders, and that remote learning has created other health problems, including mental health problems, poor habits, and decreased educational growth. There are numerous private schools opening safely, and public schools should be encouraged to do the same. If the DuPage Health Board truly cared about the overall well-being of students, they would encourage in-person learning for the majority of students. Comment, Abigail Emerson, Glen Ellen. The families, and particularly the children of DuPage County, are needlessly suffering due to school closures and forced remote learning. Without clear encouragement and assurances from the Department of Health, school unions and administrators have been able to hold our children's education hostage despite the incredibly low transmission rate in schools in the absence of any COVID hospitalization of children in this county. Our district administration and board have insisted on 6 feet of social distancing, making it impossible for us to return to critical full-time in-person learning. We implore you to change the language and guidelines and urge our teachers and students back into the classroom for the health and well-being of this county. Thank you for all you do. Comment, Lisa Peterman, Wheaton. We need our middle school and high school students back in school in person. Private schools and elementary schools have been in person all semester. Studies and data shows COVID is not spreading in schools. Get these kids back in person. Comment, Stephanie Dorsey, Glen Ellen. It is the DuPage County Health Department's job to protect the citizens of DuPage County. Allowing school districts to bring students back to in-person learning while community transmission is so high is completely irresponsible and not in the best interest of our communities. I urge you to take a strong position, urging districts to take an adaptive pause until transmission has been reduced to a reasonable level. Loud parents should not be given the power to bully districts to submit to their will simply because having their children home is inconvenient. Thank you for doing everything you can to keep our communities safe. Comment, Kristen Seaman, Glen Ellen. Asking to change return to school framework to say that kids should be in school regardless of community transmission, and in case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene, and contact tracing. School districts and superintendents can make their own decisions, but it's very difficult for a school district to go against the guidance from the health department. The health department should be considering all of the studies that show schools are not super spreader events and they are safer than the community at large. Comment, Lisa Jost Wheaton. I implore you to change your return to school framework to say that kids need to be in school regardless of transmission rates in the community. If the rates are really high, then simply require mask distancing, cleaning, hand washing, and contact tracing. Kids need to be in school. Comment, Jennifer Schoener, Glen Ellen. It's time to start putting our kids first during this pandemic. Schools were first to close and last to open back up. Sports and important kids' activities that are essential for mental health have been canceled for a virus that has been proven over and over again not deadly for kids. We also know now that kids are the absolute last in line for the vaccine. Enough is enough. Schools are not spreader environments for COVID. If airlines can fly people around the country in much closer environments safely, we can have kids in schools. Private schools have been open for months with no issues. Public schools need to open up now. In fact, they should have been open since August. Please update your guidelines to finally put kids first, especially for their mental health needs. You are failing the community if you don't update these guidelines for school settings immediately. Comment, Therese Petrine, Lombard. I'm asking you to please reconsider your metrics so we can get our kids back in school. Our kids are suffering physically, mentally, emotionally. This data has changed, and it is recommended that kids attend school as it is one of the safest places for them to be. They need to be back with their peers and teachers. Thank you. Comment, Lisa Jones, Glen Ellen. I'm writing to ask for the return to school guidelines be changed and not dependent on community numbers. If we follow the science, schools are not super spreaders. Prime example, all the private schools are in session every day and the sky hasn't fallen. There is more harm being done to our high schoolers with social isolation and falling behind other states who continue to provide a quality education. Don't let more children fall into depression and take their life. This is more deadly to our children. Comment, Ryan Griffin, Glen Ellen. Our family supports having our 3 children attend school in person. At-home e-learning is not providing our children depth, breadth, and quality of education that our school district is capable of delivering. In addition, our kids are missing out on the social interactions that are so significant to their personal growth and development during this phase of their lives. Finally, our teachers deserve the opportunity to share their passion, skills, personalities, and talents in an optimal environment. Local private schools have already demonstrated over the last several months a low risk of infection and spread of the COVID-19 virus. Our district certainly has the resourcefulness to equip our community with the optimal educational experience that Glen Ellen can offer. Please don't live in fear and demonstrate cowardice to our children. Please rise to the occasion and deliver our teachers, students, and their families with the experience that we all need and deserve. Penny.
Comment, Kim Casales, Downers Grove. Health Department needs to relate the data that schools are not where the COVID cases are occurring and spreading. It is the long-term care facilities. Rely on the data on your website that clearly shows children are not hospitalized nor dying from the virus. Then let's compare 2019 flu data with flu data from 2020. Is there any? Comment, Jen Pickering, Downers Grove. Open schools and open our way of living. This is not American and is literally killing our children. The risk of kids dying is 0.000103%. There have been dozens of suicides in our area. Enough is enough. Start protecting our kids and stop worrying about red tape. You are killing our children. Every death is on your hands. Shame on all of you. Comment, Debbie Jensen, Downers Grove. Please change your return to school framework to say that kids should be in school regardless of community transmission. And in case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning, and disinfecting, healthy hygiene, and contact tracing. The website also says that school districts and superintendents can make their own decisions, but it's very difficult for a school district to go against the guidance from the health department. The health department should be considering all of the studies that show schools are not super spreader events and that they are safe, safer than the community at large. Comment, Trisha Budka, Darian, please consider changing the return to school framework so that our children can be in school regardless of community transmission, and that if there is a case of high community transmission, hooks should follow the 5 mitigations: mask, hand washing, cleaning, and disinfecting, healthy hygiene, and contact tracing. I understand that it is ultimately up to our schools to make the decision of our children attending in-person learning, but some districts find it hard to go against the guidance from the health department. Please consider the data and make the change. Our children need to be in school. Comment, Zubin Schroff, Winfield. It's long overdue that there is a push to get kids back in school with hybrid learning at a minimum. Studies have proven schools to not be a place for community transmission due to the mitigation measures taken. They are much safer than almost any other community places. Please reaffirm the mitigation measures of masks, washing hands, distance, etc., but also provide guidance encouraging schools to reopen. Schools are afraid to go against guidance provided by the health department. Adopt the shorter quarantine times recently recommended by the CDC's so asymptomatic teachers and students can get back in person sooner after an exposure. Our kids are at great risk academically, emotionally, and mentally, a much greater risk than presented by COVID. They are now at a tipping point and need to see hope and a recovery path into 2021. The state has taken extreme precautions until now. However, we need to start helping the schools move forward or we risk real long-term damage to our youth. Comment, Jason Byer Hinsdale. I'm a resident with 2 daughters in grade school. I started a Facebook group called Children's Mental Health during COVID-19 on April 27th, after it became clear Governor Pritzker was colluding with the teachers' unions to block school openings using the IDPH, ISBE, and various health agencies. My assumptions were proven correct since schools have opened across the country, with Illinois public schools seriously lacking with in-person learning. Children in Illinois are suffering from severe depression, mental illness, and suicide due to the conspiracy. My group is now the largest mental health group for children in the world, started right here in DuPage County. That's nothing to be proud of. The schools need to be open now without delay. Thank you. Comment, Ellen Kawara, Downers Grove. Please recommend that all schools should be in session. It's not healthy for children to be at home staring at a computer screen all day. The impact on children's mental health is very negative. Schools have not proven to cause high transmission rates. Private schools in DuPage County have been open successfully since the beginning of the school year. Please change the guidelines to recommend and ask schools open immediately. Thank you. Comment, Francine Garman, Carol Stream. I believe kids should be in school regardless of community transmission. And in case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene. Because school districts and superintendents can make their own decisions, what parents want, along with considering all of the studies that show schools are not super spread events and they are safer than the community at large, should be the basis for the decisions being made. Get our children back in school. Comment, Leah Dan, Glenn Ellen, please consider changing the return to school framework so that children can return if schools follow the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene, and contact tracing. Thank you for your consideration. Comment, Mark Davis, Glenn Ellen, consider changing the guidelines on returning to in-person learning. Virtual learning doesn't work for younger kids and debatable on everyone else. Kids must be in school. It can be done safely, but the rigid guidelines are not allowing this. Comment, Marty Boyd, Glenn Ellen, please change the return to school framework to include that kids should be in school regardless of community transmission. And in case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene, and contact tracing. School districts and superintendents can make their own decisions, but it's very difficult for a school district to go against the guidance from the health department. The health department should be considering all of the students that show schools are not super spreader events and they are safer than the community at large. Comment, Lisa Esposito, Glenn Ellen, remote learning does not work for many kids, especially high school. There are honor students failing classes and kids who were previously struggling are continuing to struggle. Depression and mental health problems are becoming more prevalent. These kids need socialization and the in-school learning. Comment, Jenny Korth, Elmhurst, please reconsider the current guidance regarding in-person attendance at schools in light of recent CDC guidance. It reflects that schools can safely operate during the pandemic with safety measures in place. Comment, Adam Russo, as a health department, I'd expect you to think logically, so I'll keep it brief. According to the CDC, there have been 156 deaths of those under 18 with and by COVID. The vast majority of deaths in the US and around the world occur with those over age 65. Recent data showed that the median age of death in Italy was 82. You need to give clear guidance to open schools. Teachers believe that working in a school is a death sentence, while all data shows that's not the case. Stop feeding unhealthy paranoia, give real guidance, and stop being political. I'm sure you realize the damage being done to kids by the lockdown. As a therapist, we're seeing more kids suffering from anxiety, depression, and hopelessness than we ever have. Further, the amount of self-injury that we're seeing as a result is high. Do the right thing and issue a statement that schools are safe to open, along with practical guidelines that get the kids back in without arbitrary metrics being at play. Thank you. Comment, Dan Gus Sanders, Glenn Ellen, our children need to be in school no matter the transmission rate. Private schools have figured it out and have had amazing success. I have 3 kids. My wife and I are on high alert as we are always picking someone up out of the dumps. They need school, they need social interaction, they need live learning, they need friends. We need leaders. Please step up. We have to begin fixing all the mental problems this has caused. It's going to take years, but we need to start ASAP. Please. Comment, Dawn Mattoon, Downers Grove. Please revise the guidelines to allow kids to attend school in person. The remote model of learning is isolating and the mental health of our children is suffering greatly. Schools fear going against the health department, yet the risk of schools are super spreaders is incredibly low. Families need you more than ever to change course and bring our kids back to school where they will thrive. Thank you. Comment, Jennifer Freakman. Schools are not super spreaders. Children are not super spreaders. School closings are hurting our children more than a virus could. Please consider revising the framework for school opening and attendance so that it is attainable for all districts. Our future is at risk with our children not in a brick and mortar school. School is more than reading, writing, and math. It's about life skills and learning how to interact socially and emotionally. Comment, Don Wagner, Naperville. Please respond to overwhelming data that around the world, the country, and the state regarding safe return to school. Change the return to school framework to say that kids should be in school regardless of community transmission. And in the case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene, and contact tracing. Comment, Dave Roche, Glen Ellen, the Board of Health must change a return to school framework to say that kids should be in school regardless of community transmission. And in the case of high community transmission, schools should follow 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene, and contact tracing. The children are at more risk driving to school than from dying of COVID. The survival rate of all cases is 99.6%. The health department should be considering all of the studies that show schools are not super spreader events and they are safer than the community at large. The damage to student from prohibiting them from going to in-person school and retarding their education and life is going to be 10 times the damage from COVID. Comment, Jennifer Bolton, Glen Ellen, please do not listen to the people who want you to change guidelines so schools can be fully open. They are a very loud minority. Most people are following guidelines and want to stop transmission. These people have realized they cannot bully school boards and superintendents into opening, and so now they are going after you. I appreciate everything you are trying to do to keep the community safe. Comment, Bill Anderson, Downers Grove, the health department needs to send a clear message to the school superintendents and boards that kids need to be back in school. A lack of clarity, being liability averse is not an excuse anymore, has left our school children isolated, depressed, and receiving a substandard education. This is on you. Please tell the school districts to have kids back 100%. If all private Catholic schools and many others have done this without causing spreader events, you need to direct the high school district to reopen and reopen now. Comment, Terry Piper, Naperville, our children are being irreparably harmed by the current guidelines. Their mental, emotional, and academic health are being failed and ignored while their physical health is minimally impacted by this virus. It has been proven schools are not places of high transmission when mitigation efforts are followed. Please change the language. The school should be remote when transmission is substantial. Schools should be in session regardless of transmission level. With masks, distancing, hand washing, there's absolutely no reason schools cannot be in session like other essential business. Since when is education non-essential? Districts will follow your guidance, especially 204. We are losing our children. This is insanity. They must go back to school. Comment, Kathy Stopka, Downers Grove, please consider changing your return to school framework to allow our students to be in school regardless of community transmission. In cases of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning, and disinfecting, healthy hygiene, and contact tracing. Your website indicates school districts and superintendents can make their own decisions, but it's very difficult for a school district to go against the guidance from the health department. The health department should be considering all of the studies that show schools are not super spreader events and that they are safer in fact than the community at large. Our students need to get back into the classroom. They are not learning properly via e-learning. Our students are suffering from anxiety and depression because they are being isolated in front of computer screens for hours on end every day. This is not healthy. Comment, Karen Wright, Naperville, please respond to overwhelming data around the world, the country, and state regarding safe return to school. Change the return to school framework to say that kids should be in school regardless of community transmission. And in the case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene, and contact tracing. Comment, Kathy Hanselin, Naperville, please respond to overwhelming data around the world, the country, and state regarding safe return to school. Change the return to school framework to say that kids should be in school regardless of community transmission. And in the case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning, and disinfecting, healthy hygiene, and contact tracing. Karen Fisher, Elmhurst, please reconsider opening our schools. Private schools have been open all school year, and there has been no reports of them being super spreaders. School districts surrounding Elmhurst have also been open with no reported super spreading. I see teachers out and about the community and even posting on social media of their family outings. Comment, Renee Ekman, Downers Grove, our children need to be in the classroom. Schools all over the country are managing to hold in-person classes, even public schools in our own town. School-age kids are not super spreaders, and we have been told many, many times how safe the high school is, so let's get the kids back. Our students are falling behind because administrators will not stand up for them. Comment, Will Ferris, Downers Grove, this pandemic has taken a huge toll on our children's mental well-being. They need to be back in school wearing masks and social distancing. The politics behind your decisions is disgusting to me. Make the right decision and open the schools and indoor dining while you're at it. Comment, Lance Lucibello, Naperville, to whom it may concern, our children of DuPage County should be in school regardless of community transmission. In the case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning, and disinfecting, healthy hygiene, and contact tracing. The following cannot be ignored: interrupted learning, increased exposure to violence and exploitation, social isolation, mental health, anxiety, depression, challenges measuring and validating learning, poor nutrition, confusion, and stress for teachers, parents unprepared for distance and homeschooling, challenges creating, maintaining, and improving distance learning, gaps in childcare, high economic costs, unintended strain on healthcare systems, increased pressure on schools and school systems that remain open, rise in dropout rates. Comment, Melissa Ward, Naperville, please respond to overwhelming data around the world, the county, and the state regarding safe return to school. Change the return to school framework to say that kids should be in school regardless of community transmission. And in the case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning, disinfecting, healthy hygiene, and contact tracing. Adam.
Comment, Cammie McLaughlin, Glen Ellen, the current recommendation of 6 feet of space between students needs to be relaxed. Our district is short on space and is doing saliva testing, but is citing your recommendation as the reason we cannot come back for more than 2.5 hours a day in person. Statistics have shown schools to be non-spreading facilities, especially with mass hand washing and now our saliva testing. Suicide rates are up and recent MAP scores show that our kids are far behind where they should be. Please relax your recommendation so the kids can get back to school. Comment, J. Ryan Potts, Glen Ellen, please consider amending the return to school framework so our kids can return to school regardless of community transmission and in case of high community transmission. The studies show that children in school are not meaningful vectors of community transmission. Schools should follow the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene, and contact tracing. Besides, all of the kids are together outside of school anyways. They should at least be learning along the way. Remote school is not working. Comment, Brea Khalid, Naperville, to whom it may concern, I would like to advocate the kids should be allowed to return to in-person schooling as soon as possible, regardless of community transmission. And in case of high community transmission, our District 204 schools here where I live in Naperville, Illinois, should follow the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene, and contact tracing. The data is coming in droves regarding the successes for in-person learning within private schools. Private schools all across Chicagoland are proving that these precautionary measures have been effective and these schools have been in person since the fall. Please change the rules for our children's sake. They are the ones suffering. Sincerely, Brea Collett. Comment, Jeff Church, Glen Ellen, the health department should change its return to school framework to state that children should be in school regardless of community transmission. In the instance of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene, and contact tracing. The health department should consider and give equal weight to all of the studies that show schools are not super spreader events and that they are safe and even safer than the community at large. The negative long-term impact of children not being physically in school is far greater to the children and community than if they are physically in school during COVID. Comment, Lisa Maston, Naperville. I respectfully ask that the DCHD revise its return to school framework to allow for the immediate return of all children and staff working in grades pre through 8. Per the CDC, these children have the lowest risk of severe outcome from COVID-19, are the most likely to comply with mitigations, and are the most academically vulnerable. Additionally, updated guidance from the CDC states the many benefits of in-person schooling should be weighed against the risks posed by COVID-19 spread. Of key significance, in-person learning is the best interest of students when it compared to virtual learning. Application and adherence to mitigation measures provided in this document and similar to those implemented at essential workplaces can help schools reopen and stay open safely. They provided a link. The superintendent and board in 204 are not making decisions based on science, but rather fear of the union. Please put our children first. Comment, Brittany Bull. Please reconsider the health department recommendation for remote learning. In-person learning is essential to the healthy development of our children. The numbers do not support the remote learning framework. Our kids are growing depressed, and at what cost? Schools are not the super spreaders and deemed essential in most countries. Private schools have remained open and have done it right. We need schools reopened for the health and well-being of our students. This is heartbreaking when the numbers do not support schools to be closed or as spreading the virus. Please reconsider, we are begging you. Comment, Catherine Martin, Downers Grove. Please update your return to school guidelines to reflect what we now know about COVID spread. If the schools are taking the proper precautions, the risk for outbreaks in the school is minimal. This is proven by the data from schools in Illinois that have returned with a hybrid model taking proper precautions. Many private schools are examples of this. In addition, the CDC and other government health agencies are urging the students to get back to in-person learning. Please look at the facts for the younger age groups and revise the criteria to reflect new learning and data. The children are suffering at home in an environment not conducive to learning. They need to be in person at least 50% of the time, if not more. My children are suffering from migraines from being on a screen all day and at night for homework, even with blue light blocking glasses. This is in addition to the feelings of isolation and depression from never seeing their teachers and friends. Thank you. Comment, Sabrina Lewis. Please respond to overwhelming data around the world, the country, and the state regarding safe return to school. Change the return to school framework to say that kids should be in school regardless of community transmission. And in case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene, and contact tracing. Comment, Bianca Vondermay, Naperville. Students need to be at school. Socially, mentally unhealthy for being home doing remote learning. Needs to stop. Enough is enough. Let's send these students back where they belong, which is at school. Comment, Lisa Grimes. I am commenting with a plea to reopen District 203 for in-person learning. The metrics for the return to learn need to be revised in accordance with all of the data and studies that do not support the closure of our schools. This is crazy. I'm a mental health professional in our community and a mother of 3 and know personally and professionally the damage that is being done to our students and families. There has to be some psychological flexibility in adapting to our circumstance. Private schools within our district are open. The mall is open. Movies are open. Stores and restaurants are open. but not the schools. This is a shameful disgrace. We are being held prisoners by our superintendent. We deserve to choose what is best for our kids, and the data supports reopening. Please reconsider, and let's work together to support this option for those of us that want and desperately need it. I can go into personal and professional examples of the damage being done. Comment, Mary Travis, Darian, stop playing politics with the lives of people who voted for you to perform your public service job in the best interest of the people you serve. Comment, Kathy Johnston, Downers Grove, please readjust your guidelines for schools. We need our kids in schools. Our kids are stressed, anxious, and overwhelmed. They need the structure. They need their teachers. They cannot learn over Zoom. They can pass in the halls with masks and shields. They can social distance in the hallway. Do what is right and get our kids back in school. Comment, Terry Foley, Naperville. Although I am Will County, my children attend School District 204, which is DuPage County. Please change the metrics for returning to school. I am more concerned about our children's mental health at this point. Please make these superintendents open schools based on mental health numbers. See Sioux Falls, South Dakota. My nephew has been in his high school of 2,500 full-time mess optional since August. Although students and faculty have tested positive, there have been 0 cases traced back to the school, 0 hospitalizations, and 0 deaths. They successfully played fall sports and are now in the midst of the winter sports season. Please publicly recommend all students return to school as early as January 4th. Comment, Lisa Rose, Naperville. I'm writing my comment as a counter narrative to the open DuPage / reopen schools comments, rallies, and calls to disobey governor's orders on indoor dining, mask wearing, etc. I am lucky enough to stay home and work, order my groceries and other necessities for curbside pickup, and generally stay out of the way. But I recognize that others do not have that luxury. Keeping tabs on numbers via Siren and DuPage County COVID dashboard have been very helpful in my decision-making process. Unfortunately, there is another mindset parallel to mine who are working to make things normal again by disregarding most of the mandates and info provided to keep residents safe. I don't think we are going to change their minds until they or someone close to them gets COVID-19 and experiences it firsthand. In the meantime, they make it dangerous for everybody. For every comment demanding opening up DuPage, there are many more who listening to guidelines and supporting science-backed data. Thanks. Comment, Nancy Sosner, Lombard. Please continue the present level of shutdowns. The statistics show that it is working to lower the infection rate. Comment, Kate Benton, Downers Grove. National experts are confirming not only the safety of in-person learning, but how crucial it is to get our kids back in school. Director of the CDC, Robert Redfield, on 11/20/20 noting very little evidence to suggest that schools are sources of spread. Redfield said, it's every bit as risky to have students at home. CDC has encouraged schools to remain open even if metrics are high. The truth is one of the safest places they can be from our perspective is to remain in school. Studies are showing remote learning is failing and our kids are failing. They are suffering additional repercussions such as weight gain, increases in risky behavior, anxiety, depression, and social isolation. Teen suicide is rising sharply. American Academy of Pediatrics benefits of returning far outweigh the risks. I would like to know what DuPage County and IDPH are doing to respond to new science, to modify school guidelines accordingly, and to support return to in-person learning. Comment, Mark Fishbein. I am a pediatric hepatologist, liver doctor at Ann and Robert H. Lurie's Children's Hospital of Chicago. I am director of the obesity-related fatty liver program there. I've been a resident of DuPage County for over a decade and have sent my children to public school in my local district. Though I have no children currently attending school in the district, I feel compelled to comment on an increasing public health issue that may not be publicized during the recent COVID pandemic. In our clinic population, we have witnessed accelerated weight gain and increased referrals. Virtually none of our clientele has lost weight. Any policy which keeps children out of school is likely to contribute to this phenomenon by allowing food access throughout the day without any structured physical activity. I think there is greater risk associated with obesity and its comorbidities than the benefits of keeping these kids home. I endorse an immediate change of policy. Comment, Lisa Keaton. Please continue to work on consistent messaging regarding testing cases, hospitalizations, and deaths, as well as transmission vectors such as schools, retail, restaurants, and other public or private service offerings. Individuals who rail against public health safety measures frequently cite reporting inconsistencies as their primary justification for their disregard of pandemic guidelines. Comment, Tony Nielsen, Glen Ellen. Schools need to remain open regardless of community transmission. Comment, Jamie Road, Lombard. Change requirements for kids going back to school. They need to be in person. My high schoolers are depressed and failing. They need to go back. Comment, Christine Slepika, Glen Ellen. I am advocating for full-time school for our children, specifically K through 8. There are health consequences, including too much computer screen time, lack of regular movement exercise, usually acquired in a normal school day, social isolation, and educational disengagement. All of this is posing a greater risk to our children than the virus. The Catholic schools and several school districts have shown that kids can be educated safely following the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene, and contact tracing. 6 feet is not necessary in keeping kids and faculty safe. Saliva testing has shown there is very low prevalence of virus among our children. Full-time school should be in planning now for an after-holiday start. There is great inconsistency within even the same counties of how superintendents are making decisions. Please communicate to our superintendents that full-time in-person school is vital to the health and well-being of our kids. Comment, Michelle Shoemaker, Elmhurst. My family implores you to change the standards currently being used to allow the kids to be back in school full-time. District 205 needs to return kids to the buildings and to sports. They are safe. The mental health implications are far worse than the virus. The depression is a much bigger issue than the virus. Their education is suffering, and Everstat shows that without question. Please make the needed changes so that my 4 children and their peers can go to school, which is their right as an American. We are suffering greatly because of your rigid standards. It is time to make this change now. All data shows you this. What is stopping you? Comment, Christine Evans. I just left Kohl's. It was packed. Yet last night, a CUSD 200 decided they needed surveillance screening in order for middle and high schools to go back to a hybrid model, not even full-time school, because they are concerned about the community. DuPage County Health Department needs to pressure these districts to do what is healthiest for our children and open the schools. We have no recourse against these poor, wrong decisions. Wheaton North High kids are getting 30-minute classes. Middle school is worse. Do whatever it takes to get these kids in a healthy environment. School. The community will be safer. The kids will be safer. Pressure on these districts and be leaders in Illinois for the sake of our children. Comment, Elena Duggar, Naperville. Please respond to overwhelming data around the world, the country, and the state regarding safe return to school. Change the return to school framework to say the kids should be in school regardless of community transmission. And in case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning, and disinfecting, healthy hygiene, and contact tracing. Comment, Victoria O'Boyle, Downers Grove. Kids need to be in school regardless of community transmission. And in case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene, and contact tracing. Gower has managed to make this happen. Schools being closed or even hybrid is a detriment to families and a child's well-being. Comment, Chad Allman, Glen Ellen. Please reconsider your return to school framework. Our kids need to be in school regardless of community transmission while closely following the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene, and contact tracing that have been successful in adjacent communities. Thank you for your consideration. Comment, Aaron Zimmer, Naperville. I just wanted to take a moment to thank the DuPage County Health Department for its guidance amidst this nationwide health crisis. In particular, thank you for recommending that schools remain or go to remote learning in what is hopefully the peak of the crisis. There are many, many parents, students, teachers, and administrators who appreciate science-based decision-making. Numbers are numbers, and we appreciate your transparency in making them available to everyone so that we can make educated decisions. Thank you, Aaron Zimmer. Comment, James McAlpine, Naperville, asking for you to change the return to school framework and return kids to school regardless of community transmission. And in case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning, disinfecting, healthy hygiene, and contact tracing. Interrupted learning, increased exposure to violence and exploitation, social isolation, mental health, anxiety, depression, challenges, measuring and validating learning, poor nutrition, confusion and stress for teachers, parents unprepared for distance and homeschooling, challenges creating, maintaining, and improving distance learning, gaps in childcare, high economic costs, unintended strain on healthcare systems, increased pressure on schools and school systems that remain open, rise in dropout rates. Comment, Deborah Morris and Glen Ellen. I'm requesting that you immediately revise your return to school framework to instruct that kids should be in school regardless of community transmission. And in case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning, and disinfecting, healthy hygiene, and contact tracing. This health department needs to be following the many studies that show that schools are not super spreader events. Schools are safe, and the impact of having them closed is far more devastating to our students than the virus. Schools are an essential service that should be open for schools at all times. Comment, Tracy Skinzer, Naperville. You need to change your guidance to schools. Let them know regardless of transmission rate, students need to be in school and follow the mask, hand washing, distance guidelines. Penny.
Comment, Carrie Brokey. I beg you to please reconsider your current metrics in regards to the COVID-19 pandemic. Our school district is using your metrics as a reason to not send our children back to school, even though almost every school district is at least hybrid. Please reconsider. Comment, Ellen Nabetti, Glen Ellen, dear board, I know there's a lot of pressure to reopen schools. Please follow the science and keep schools safe. Do not allow parents to bully districts into reopening in situations that could put students and staff in danger. I know remote learning isn't ideal, but we need to remember to place Maslow's hierarchy of needs before Bloom's taxonomy of higher order thinking skills. Please err on the side of caution to keep our community safe. Comment, Melissa Deegan, Naperville. I am a parent of students in Naperville 203. For months, I have listened to 203 Superintendent Dan Bridges blame the DuPage County Health Department guidelines for not allowing students to return on site to campus. Meanwhile, students were permitted to play football, run cross country, and swim at the high schools, but were not permitted access to on-site learning. Bennett Academy, All Saints Academy, and St. Raphael have offered in-person learning successfully since August and September. Wheaton 200 has elementary age students on site as well. 203 has stonewalled and refused to DCHD. The impact of 9 months of isolation is manifesting itself in students in the form of depression, social isolation, and developmental regression. The change in children's mental states is disturbing. The executive director of the DuPage County Health Department needs to redefine metric standards and guidelines to public schools. Comment, Alice Romano, Glen Ellen, please revise your return to school framework to state that kids should be in school regardless of community transmission. Please consider all the strides that show schools are not super spreader events and that they are safe. Our kids need in-person learning, and there are many mitigation levels they can take to safely return with your guidance. Comment, Carrie Swenson, Downers Grove. I have left 3 messages for the Education School Department with no callbacks. I have 2 items that I would like addressed. 1, high school passing periods. Please explain to me how this is any more dangerous than walking down a supermarket aisle wearing a mask, passing tons of strangers, often more than once. Let's remember that students are wearing masks and shields and schools are at 50% capacity is not a risk by CDC guidelines. 2, how can your criteria for school opening be based on multiple positives for one patient and now out-of-state cases erroneously coming to DuPage, including college kids, dual state residents? This has been confirmed. You are using metrics created many months ago to get kids onto school that use risk factors that are wrong. Or a person has 2, 3, 4 positive tests, as often happens going back to work and hospital stays. They can only be at risk once in a community. This needs to be revised. The metrics are antiquated. Use numbers relevant to, and then it just ends. Jennifer Springer, Naperville, kids need to be back in school ASAP. Schools is in the safest place for them with the safety protocols of masks, distancing, etc. Kids' mental health is suffering greatly each day that this remote learning continues. Please change your stance on this so all kids have the option to return to school ASAP. Comment, Mary Beth Baskin, Naperville. I do not understand why schools continue to be recommended to be remote in Illinois when Dr. Fauci, the CDC, and numerous pediatricians have stated their recommendations for children to be in-person school. Numerous schools have opened in person in other countries, states, and even districts within Illinois with no large outbreaks. There are ways to do this safely. Children are being damaged in ways we cannot see yet by these school closures. Their social, emotional, and academic health must be top priority. It has been 9 months that these children have not been in school. You hold the power to change this. Too many will not act if opening is not a direct recommendation of the health board. I urge you to put the kids first and do the right thing. It has been proven it can be done safely. Comment, Joan Vitro, Naperville. As numerous reports, this being the latest, a link was provided to the Chicago Sun-Times. The return to school framework needs to be changed that kids should be in school regardless of community transmission. In the case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning, and disinfecting, healthy hygiene, and contact tracing. It is not working to have school districts make their own decisions. It is resulting in a lack of leadership and community chaos on what the right decision is. DuPage Health needs to make a leadership statement that all schools in the county should reopen in a safe way. Thank you. Comment, Michelle Fenton, please change the guidelines to prioritize getting children back into the classroom. The guidance regarding the vaccine and who is most vulnerable should make it clear. Our children are not at risk of contracting COVID-19. If they do get it, the symptoms are very mild. By not being more flexible and relaxing the guidelines for the metrics used to allowing in-person learning, you are harming these poor children more than any virus could. Comment, John Mullerkey, Naperville. Board members, please review the following list of members of the global educational community who acknowledge and support the indisputable scientific evidence that primary school education is not a significant source of COVID spread and that the dangers of enforcing early childhood isolation far outweigh any risk associated. Provided were the UNICEF, the World Health Organization, CDC guidelines, American Academy of Pediatrics, Journal of the American Medical Association, New England Journal of Medicine, the National Academies of Science, Engineering, and Medicine, Dr. Anthony Fauci, and Dr. Dimitri Christakis, Dr. Sanjay Gupta, Asha Jha, Dr. Mark Lipstick. lip stitch, sorry. Please recommend a return to in-person primary school education immediately. Comment, Mike Dom, Naperville, we need the DuPage County Health Department to be a leader for our students and youth. There is mounting evidence that in-person school is where kids need to be and can be done safely. Schools within DuPage County are doing it safely right now. Districts across the country and world are doing it safely. Our district, as well as others, are relying solely on your guidance and have stayed closed for months based on metrics they don't understand. I live in Naperville School District 203 in DuPage County, and they have stated they will not open in-person schooling because the DuPage County Health Department is recommending against it. Study after study shows that it can be done safely, especially in our elementary schools. We are doing irreparable harm to our students, and it is all because of the recommendations from the DuPage County Health Department. Our daughter needs to be in person to learn. She has special needs, and because of your guidance, she is not getting the education she needs. Comment, A. Johnson. Online learning has been horrific in Naperville 203. My junior in high school son is currently dropping off his application and transcripts to transfer to a private high school at his own request because the education is so poor. On average, his day is over before noon. District 203 and Bridges have done a terrible disservice to the students. In-person school needs to be mandated. Comment, Jill Engelke, Naperville. I am writing to ask that you please revise the metrics for kids to return to school. We have been e-learning far too long. There are plenty of schools around DuPage County that are in school, as well as the parochial schools in DuPage that have very low COVID transmission rates. The school should follow the 5 mitigations of masks, hand washing, cleaning, and disinfecting, healthy hygiene, and contact tracing. You need to be looking at all the data and studies that show schools are not considered a super spreader environment. Thank you. Comment. Amy Laverty, Downers Grove. I'm writing to you today to please make strong recommendations for our schools in DuPage County to offer in-person learning option. The research and scientific data makes it clear that schools are safe and children under age 20 are not dying with a 99.99% recovery rate. Schools are essential and the damage being done is becoming irreparable when lives are lost nationwide due to mental health and emotional problems. Schools are safe with proper precautions. Teachers and staff are safe as well. Please give our schools guidance on reopening next semester, as many schools have done already. Thank you for your attention in this matter. Comment, Donna Slevnik, Naperville, you're doing a great job keeping us safe. My grandpa always told me when you have your health, you have everything. Please stay the course so I continue to have everything, just like my grandpa told me over 50 years ago. Thank you. Comment, Mary Grisink, Willowbrook, DuPage County must prioritize public health over the wish to keep restaurants open for dine-in experience. We must follow the science to keep all community members safe, keeping only essential businesses open. Masks should be mandated along with social distancing requirements. Dine-in causes masks to be removed in non-properly filtered establishments. Comparing dine-in restaurants to big box stores and supermarkets is not relevant, as you don't remove masks to eat in your supermarket or your pharmacy or your Target. If you want to eradicate this virus more quickly, support takeout and curbside pickup versus dine-in at restaurants. Wear masks, social distance, wash hands, take the vaccine when we are told by scientists that is safe to do so. The life you save could be your mother's or your son's. The life someone else saves could be your father's or your daughter's. We just don't know who we could save just by wearing masks and carrying out our food, but we can save lives now. Comment, Marianne Boyke, Elmhurst. I have 2 kids at York High School and a 7th grader at Bryan Middle School. Watching this ongoing disservice to mine and all of our children that are stuck in remote learning is like watching a flower die on a daily basis. Slowly but surely, these kids aren't learning and they sure as heck aren't thriving. How do you sleep at night knowing you are holding our kids hostage and destroying their growth and development? And while many take their own lives because they can no longer take it, how many suicides do you need to have happen that are far greater in numbers than those that are just sick, not even dying of COVID? You have the power to follow the facts and the science and get kids back in school 5 days a week where they belong. Stop hiding and do your job by doing what you and everyone else in this already doing in person. No is right. Get these kids back to school now. Comment, Karen Vest, you will be receiving many comments from local parents demanding schools reopen in spite of high transmission rates. These same people are in our community who travel out of state, socialize and travel with others outside of their household, continue to dine in establishments, defying orders to stay closed, and do not promote mask wearing in the community. These people will be the loudest voices who are demanding and harassing teachers who live in our community that their lives and efforts to keep their families safe do not matter. Please do not give into the angry mob. Do not reopen the schools until our community learns how to behave, stop being selfish, and to stop the transmission. Teachers should not have to risk their lives to teach children in person when there are alternatives available. Science and data does not back reopening schools, especially when there's such high community spread and ambivalence. Thank you for your time and consideration. Comment, Tracy Zach, Naperville, please change your guidance on school reopening. Naperville CUSD 203 is interpreting this guidance as a mandate. They have made it clear that they will not open while your guidance is what it is today, even though neighboring DuPage County schools are making hybrid work safely. CUSD 203 fears lawsuits by teachers and they fear the union. Students are suffering. This neglected by the district is appalling. The only thing that will get them to create a plan for hybrid is if you amend the verbiage of your guidance accordingly. Comment, Janice Gilmore Wheaton, I urge you please do the research necessary to see that schools are not super spreader environments. The middle and high school children of our school district have not been in school since March of this year. They had a month of 2 days a week. That is it. Numbers were contained and did not spike as a result of being there. Their mental health and emotional well-being depends on it. Comment, Thomas Neal, Elmhurst. I am a resident of Elmhurst and a father of 3 school district 205 children. Just like most people back in the beginning of 2020, I was very concerned about COVID-19. It was not well understood and time, and being a student of history, I was worried about another repeat of 1919. However, we have since learned a great deal about the virus, which demographics are and are not at risk for serious complications and death. We should be very thankful that our children seem to be least impacted by this virus. Many other countries around the world chose to keep their schools open. With additional safety measures in place, there have been virtually no community transmissions due to school reopening. You as health officials should be familiar with the scientific method, hypothesis, test, gather data, reassess the initial hypothesis. Well, it is time that we take a hard look at the data and reassess our assumptions about this virus. The vast majority of people under the age of 70 are not at risk for serious complications or death. If we are indeed most concerned about immunocompromised individuals working in classroom settings, what might the alternatives be to having over 8,000 students remoting into school 5 days a week? The current situation is not sustainable. It is leaving many children with a lost year of education. There will be consequences of the decision to keep schools closed. Could we not do what we should have done at the very beginning of this pandemic? Protect the vulnerable as best as possible, but at the same time not sacrifice the educational well-being of our children, not to mention the economic health of our nation. I suggest that this can be done. We can protect those teachers and staff and get our children back to a full-time in-classroom education. The time to act is now. Eventually, this pandemic will be over and history will judge the actions of those in leadership. The data points to reopening the schools. Even many health experts have stated this fact recently. I pray that you will do the right thing. Thank you. Comment, Sarah Foster, Naperville, per a November ISBE Tier 3 mitigation update, IDPH, ISBE, and CDC guidelines allow schools to be open, provided cleaning, health, self-certifications, masks, other PPE, limitations to groups under 50 people, and distancing 6 feet if possible are in place. Unfortunately, schools are justifying indefinite closures based on DCHD's restrictive community case metrics and risk assessments and associated guidance modeled on Arizona, not Illinois Health Department guidelines. Lake County Health Department is reducing its COVID-19 case county metrics, provided that ISBE mitigations are in place. DCHD should follow LCHD's lead and allow schools, if ISBE mitigations in place, to fully reopen. Neither case positivity nor hospital bed availability should interfere with our kids' rights to school. In DuPage, kids are neither filling all hospital beds nor dying of COVID. If COVID cases are used, use only youth cases for the school's applicable ages. Show the data on the dashboard. Comment, Cynthia Cashel, Naperville. Please look at correct statistical information. It's been proven that schools are not spreaders of virus. These guidelines need to be changed for our youth to be back in school, sports, and clubs. I think your bigger concerns and studies should be on the effects of keeping children out of school and the long-term effects that this will have on them, like mental illness, suicide, depression. Get these children back in school. Thank you. Comment, Jane Calandrello. Good afternoon. I would like to express my support for a change to the county's return to school recommendations. Specifically, I would like to see the county recommend that kids be in school regardless of the level of community transmission of COVID. While I understand those are simply guidelines, I believe your action can help return children to school quickly and safely. Thank you for your time. Comment, Laura Ruan, Naperville. Hello, we are having some serious return to school issues here in Naperville. The public schools need to go back to school with safety precautions, of course. The Catholic schools have been back full-time since August. They are fine. It's so hard watching these kids, grades K2 through 12, go to school every day and the public kids are at home 100%. The virus does not know the difference between public and Catholic kids. Please help 203 and 204 kids return to school with your best recommendation. Thank you. Comment, Carrie Swenson, Downers Grove. There was not enough room to finish my comment. I am furious that this health department uses metrics from 60-plus-year-old cases and deaths. I don't know many teachers that 70, 80, or 90s. These metrics do not account for zero death under 20, almost zero hospitalizations for under 20. These metrics refuse to listen to CDC, WHO, Fauci, and need to be revised based on 10 months of data. Many schools are in session and clearly they don't have an issue. Please stop using metrics from elderly cases and deaths and applying them to school age settings. Where are your mental health stats? Why is this not a factor? Revise your metrics to actually be of use to the community and education system. It is time to stop this overreach by the health department so we don't lose more children to mental health issues. Are you even aware of how many attempted suicides, medicated depression and anxiety, obesity, eating disorders? It's time. Parents want kids on school. Parents don't have a remote option. Comment, Mary Reed DeZintos, Naperville. Thank you all for protecting the health and well-being of the citizens of DuPage County, especially in the face of this COVID-19 pandemic. I appreciate your science-based approach to managing and mitigating COVID-19, and I especially value the data that you collect, collate, and distribute so that we can all be partners in helping to protect the health of not only of ourselves, but of our families, friends, and neighbors. Comment, Kathy Lohman. The many benefits of in-person schooling should be weighed against the risk posed by COVID-19 spread. Of key significance, in-person learning is the best interest of students when compared to virtual learning. Application and adherence to mitigation measures provided in this document and similar to those implemented at essential workplaces can help schools reopen and stay open safely for in-person learning. A link was provided to CDC. Please respond to overwhelming data around the world, the country, and the state regarding safe return to school. Please consider modifying the return to school framework. Comment, Jason Mujeri, Naperville. The kids need to be in school in person effective immediately. As other states have shown for literally months, the rate of transmission in schools is low and does not outweigh the damage online learning is inflicting. This needs to stop. The virus will be here forever. Almost all will fight it off like they do countless other viruses. Online learning, however, if this continues, will cause irreparable damage to the vast majority of students. Our school district 203 will not listen to us. They may listen to you. For the love of God, tell them to return the kids to school and follow the same guidelines we do at Walmart. Adam.
Comment, Consolita Ertmode, Nevada. Safer to have the children in school learning than at home staring at the wall. Comment, Sandy Whited, Naperville. DuPage County residents appreciate the efforts of the health department to do their job. In case you are hearing otherwise, the DuPage County Health Department exists in part to keep us safe in the event of a global pandemic like COVID-19. Thank you for doing the work that we have hired you to perform. Comment, Jenna McKinnon, Naperville. Thank you for the work you have done to make sure our community is safe from the most recent virus. I know you have stated before that your guidelines for schools are just guidelines, and it is up to each school district to determine if they can return to school. However, Naperville 203 is claiming that they cannot open because IDPH does not recommend it due to current COVID numbers. Many DuPage school districts and private schools have been extremely successful in their in-person learning implementation. I feel that it is very important that our children return to school, and although you do not have the authority to direct schools to return, it would be ideal if you could make it very clear that you recommend that children return to in-person learning. Our superintendent and school board are using you as their scapegoat. Please change the wording of your guidelines to not allow this to happen. Thank you, Jenna McKinnon. Comment, Lori Nourse Buzzle, Elmhurst. Please reopen District 205 schools. My daughter struggles and her confidence waning. My daughter is exhausted trying to navigate the changes and to participate. Having an IEP to address ADD, sensory deficit, as well as her slow processing speed is hard enough to accommodate inside the school. Fully online, she simply can't keep up regardless of her labor and desire. If she misses instruction because she gets sidetracked and snaps out of it, she's not able to get social cues from her classmates to assist her. She can't just see that is say on page 97 in their math lesson and feel incompetent and shame. There is a lack of motivation as she gives up or is caught up in, if I don't know soon where we are, then I won't be able to keep up, and then I won't be able to work how I need to in the next task. The stress also creates a lack of value in the task at hand, like it's not worth. My child is G. Comment, Lisa Paprock, Elmhurst. Please change the return to school framework to say the kids should be in school regardless of community transmission. And in case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene, and contact tracing. What website also says that school districts and superintendents can make their own decisions, but it's very difficult for a school district to go against the guidance from the health department. The health department should be considering all of the studies that show schools are not super spreader events and that they are safer than the community at large. Please consider making a change because there are so many kids, especially the middle schoolers, even my fifth grader and high schoolers, that are truly suffering from depression from being so isolated with 100% remote learning the past several months. Kids not being in school 5 days a week is having a huge effect on parents that need to work. Comment, Lisa Pomeroy Burridge. The CDC revised COVID quarantine time to 7 to 10 days. The data shows children in schools are not super spreaders. Revise your guidelines so schools can open full-time in person and that children with COVID are only out 7 to 10 days instead of 2 weeks. Comment, RJ Urici. Can you please reconsider your health department's recommendation for remote schooling or in-person learning is essential to the healthy development of young people in our county? Please have your health department consider recommending that schools be in person. Or schools are not super spreader events when proper mitigation such as masks and hand washing are taking place. Please change your health department school metrics to allow for in-person schooling now. Our children are suffering from remote learning in many different ways. Thank you for your consideration. Comment, Rosario Paredes. I encourage DCHD to note the importance of children being able to return to school. There are many children suffering the collateral effects of being out of touch with their peers. It is human nature to desire and strive for in-person connection. We cannot risk our children's well-being for the unscientific safety of a part of the population who would like to continue hiding from a virus. It has been proven that children with no comorbidities are at very low risk, but we still punish the whole pediatric population following pseudoscience. It is time to let our children return to school normally without the limitations of having to wear a mask. If a person, teacher, staff, or student is afraid of contracting COVID-19, they should be the ones wearing ASTM level 3 protection. Universal masking is not productive as we have seen the numbers statistically. Comment, Stephanie Raquel Naperville, writing today to ask you to please allow children of all ages to return to schools. Children are not vectors and they do not spread this virus, and those spending time outdoors get vitamin D, minimize their risk further. Probably already well aware of studies from Iceland, the USA. Parents are now sending kids back to in-person school. For reference, I'm a mom and a foster parent as well. Watching a kindergartner through the initial stages of lockdown and then a second and third grader who were trauma survivors and already struggling academically proved the research that shows minority and poor populations are struggling in huge ways. For our teenagers in high school, they are struggling with the lack of social interaction and routines found in their school experiences. As a family, we would be incredibly grateful if the health department would follow real science and data. Comment, Tamara Williams Aurora. Please change the return to school framework to state that children should return to in-person learning in the buildings. Please support the recommendations from all highly regarded studies, CDC, government officials that urge that all children should be back in school. The district boards of education in this area are looking to you for guidance in their decision-making. Our children's academic, physical, and mental health are riding on this transparency. Comment, Monica Lucibello, Naperville. I am writing to ask that you please change the return to school framework so kids will be able to return to school regardless of community transmission. In cases of high community transmission, recommend that schools follow the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene and contact tracing. This is important for our children and our community. Thank you, Monica Lucibello. Comment, Amy Leo Lombard. Please reconsider current metrics regarding return to school. Thank you. Comment, Caitlin Chadwell Naperville. Please change the return to school framework to say kids should be in school regardless of community transmission. And in case of high community transmission, schools should follow the 5 mitigations of masks, hand washing, cleaning and disinfecting, healthy hygiene, and contact tracing. Comment, Stephanie Siska Naperville. I'm the parent of 3 District 203 students. For several months, our superintendent and BOE have blamed the DPHD for not allowing students to return to the classroom due to your required metrics. Meanwhile, downstate schools, including Peoria, have offered in-person school for months, as well as districts near Naperville, including Wheaton 200, and private schools all around Naperville and Aurora, St. Joan of Arc Lisle, All Saints Naperville, Benedict Academy Lisle, St. Michael's Wheaton, just to name a few. They are all following strict guidelines and protocols, yet Dam Bridges claims those metrics make it impossible for 203 to open. The negative impact of remote learning on my junior high students is alarming, disconcerting, and becoming unbearable. We are reading of teen suicides and increased visits to the ER and admissions to mental care facilities daily. The DPHD needs to immediately redefine the metrics for opening schools to align with expert recommendations that they be open. Comment, Philip Buchanan, Naperville, DuPage Health Department. Doctors and nurses are a precious resource, overworked. We have lost some healthcare staff due to COVID. Some will not come back. Wear a mask, get your vaccine shots, follow the guidelines. Comment, Jennifer Burns, Hinsdale. At this stage of the pandemic, the harm being done to children by remote hybrid instruction is far more extensive than the health risk of COVID. Our children need to be in school 5 days a week. There is no effective substitute for in-person instruction. The daily social interactions of school attendance are as essential to normal social and emotional development as in-person instruction is to learning. With all due respect, I'm requesting that you make getting students and teachers back in classrooms the top priority. Thank you. Comment, Rebecca LeChucky, Lombard. Vaccinations should be available to those that want them, but seen as the endpoint of the trials was not prevention of COVID infection, we should, as a county, push for long-term studies and therapeutic treatment. DuPage Medical Group is having good results in their trials. Can we support them as a county? Also, can we publish recovery rates and hospital discharge dates to be more transparent in data? Comment, Janisa Cannon. We need support for more therapeutics, not vaccines. This is asinine to force a liability-free product on a population, especially children. That's essentially what you are doing. Comment, Andrea Kinnan. Mandating a vaccine that itself comes from a company granted immunity from all liability should cause us great pause. There have been no long-term studies. Some studies that have been done, even in these early stages, reveal that the COVID-19 vaccine may have consequences in human fertility and fetal viability. This should be of considerable concern, especially in the topic of vaccinating children. This vaccine needs more time to be adequately studied before it is offered as a reasonable option for human use. And it should be up to each individual without compromise whether or not to inject any substance into their bodies. Comment, Elizabeth Kolke. I oppose liability-free fast-tracked COVID vaccines. No long-term health studies have been done. mRNA vaccine, new technology, and needs more testing. I support more therapeutic remedies and not vaccines for this virus. Comment, Gomez Raul. The COVID-19 vaccine uses a new experimental type of technology, mRNA, which has never been approved for human vaccines before. It has been fast-tracked, and there needs to be long-term health studies performed instead of using the population as lab rats for post-market data in this experiment. There is no data that confirms the COVID-19 prevents transmission, and the CDC reports the virus has over a 99% survival rate for the majority of the population. Please keep these facts in mind when discussing the COVID-19 vaccine and support the existing therapeutics that have helped patients fight COVID-19. Thank you for your time. Comment, Christine Cates, Wheaton. I am completely against the widespread distribution of a COVID vaccine at this time, which has been fast-tracked with no long-term studies. This is a very dangerous proposition for all citizens. There's an extremely high risk for injury and possibly even death in many cases. Therefore, I do not believe the DuPage County Health Department should approve of this effort at this time until there are further studies of efficacy and safety. Comment, Miranda Brush, Peoria. Please consider that this vaccine has been fast-tracked and untested on children. The unknown health consequences of an untested vaccine should be considered in the decision-making process of making this mandatory for the public. Comment, Amanda Lutzy, Antioch. Please do not be hasty in rushing out this liability-free product that has zero long-term studies. The residents of Illinois are entrusting their health and future based on your decisions, and that fast-track, first of its kind, new experimental vaccine cannot under any circumstances be deemed safe after only several months of hand-selected candidates for testing. Comment, Diana Chiato Glenellen. Regarding the emergency use for the COVID vaccine, I oppose until further safety studies are done, as there may be long-term side effects. Rushing something like this is irresponsible, especially where no one has liability, not you and not the pharmaceutical company. Let us not rush for a Band-Aid solution that may be worse than the virus itself. While I do believe vaccines can be beneficial, I think money and time be allocated to tested and tried therapeutics, not a brand new, never used before mRNA vaccine. We should not be experimenting with any human, let alone our youth who are still developing. This is not responsible. Please consider waiting and doing further research and not proceeding with an EUA at this early stage of the crisis. Comment, Sue S. Dear board members, the COVID-19 vaccine has not been proven safe and effective. There have been numerous reports from both Pfizer and Moderna of adverse events from the participants in the trial, ranging from transverse myelitis to Bell's palsy to severe anaphylaxis. This vaccine has been rushed, and the pharmaceutical companies are not liable for the adverse effects. In no way should a vaccine like this ever be mandated. I want you to proceed cautiously with what decisions you make tonight regarding the COVID-19 vaccine. Thank you for your time. Comment, Christina Giunta, Naperville. First and foremost, approximately 99.74% of people who have had COVID will fully recover. There will never be a vaccine that is as effective as a healthy person's immune system. So now let's talk about the approximately 0.26% that are at highest risk of succumbing to COVID. How about our health departments start talking about COVID therapeutics? There are thousands of doctors worldwide talking about and testifying before US Congress about successfully using COVID therapeutics, even in those that are most vulnerable to COVID. But instead, our government and health departments only focus on fast-tracked, highly lucrative vaccines as the answer, where when someone is injured or killed from vaccines, they are prohibited from filing a lawsuit against the vaccine maker and can only go begging to the government by petitioning an administrative court in Washington, D.C. Lastly, recent statistics suggest that around 50% of the public are concerned about a COVID vaccine, and rightfully so. Comment, Trisha Crowley, Chicago. Say no to fast track COVID vaccine. Comment, Amanda Mura, Hinsdale. I oppose emergency use of this new mRNA vaccine when the manufacturer has zero liability for injuries. Comment, Nia Esposito, Glen Ellen. I oppose the fast track COVID vaccine. This vaccine should be optional, not mandatory. There have been no long-term health studies done on this vaccine. There are many sustainable therapeutics for this virus. Comment, Gabrielle Rezek, Wheaton. I oppose fast tracking this vaccine for 16/17-year-olds and all children. Comment, Teresa Gannon, Clarendon Hills. Please open all high schools in our county. Our district is D86 and our children need to be in person at school with their teachers and peers 5 days a week at ACIP.
Mr. President, that concludes
End
the
of our
public comments.
Thank you. Thank you, Penny. Thank you, Adam. You have once again surpassed anything we could have expected and have worked above and beyond. We really appreciate it. And thank you to all of you who did take the time to publicly comment. It is not our policy to respond to public comments at the board meeting for some obvious reasons, but as you may or may not know, if you're listening in, all of us spent the last 2 hours or so listening to the public comments, and we certainly appreciate your input on all of the topics that were discussed tonight. Moving on tonight's agenda, I will entertain a motion to approve the minutes of November 12th, 2020.
So
So
moved.
moved. And second, Lanny Wilson.
Who was the motion made by? I'm sorry.
Weeks. JP.
Motion by Dr. Weeks, seconded by Dr. Wilson. Any additions, corrections, or deletions? Hearing none, seeing none. Roll call, please, Penny.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munier,
Yes.
Dr. Skelton,
Yes.
Mr. Spadoni,
Yes.
President Tornatore.
Aye.
Mr. President, the motion passes.
Thank you. The minutes are approved. Moving on to the treasurer's report. I will turn this over to Mike.
Thank you, Mr. President. As of October 1st, the Health Department General Fund balance totaled $33,505,840.76. Receipts for the month totaled $3,419,234.60, and disbursements totaled $5,042,459.43, leaving a month-end total in the Health Department General Fund of $31,882,615.93. Combined balances in all four health department funds as of October 1st total $43,425,533.65. Combined receipts for the month total $3,579,153.29, and combined disbursements totaled $5,426,380.60, leaving the combined balances in all four health department funds at $41,577,836.34. Investment earnings recorded to the general ledger in the month of October for all four health department funds totaled $4,557.65. Including these earnings, year-to-date combined investment earnings has totaled $228,666.57. Any questions?
I'll entertain a motion to approve the treasurer's report as submitted.
So
Lanny.
moved.
Motion by Dr. Wilson, seconded by Mr. Spadoni. Any questions, comments on the treasurer's report? Hearing none, seeing none. Roll call, please.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munier,
Yes.
Dr. Skelton,
Yes.
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks.
Aye.
Mr. President, the motion passes.
Thank you. And the treasurer's report is approved. Thank you, Mike. Moving on to consent items, I'll entertain a motion to approve personnel transactions as set forth in the packet.
So moved, Lanny Wilson.
Second.
Motion by Dr. Wilson, seconded by Mr. Spadoni. Any questions, comments on personnel transactions for the month. Hearing none, seeing none, roll call, please, Penny.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munir,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks.
Aye.
Mr. President, the motion passes.
Thank you. Moving on to item 8, we did amend the agenda to go to do item 8.2 first, and that would be I'll entertain a motion to approve the utilization of general fund 70 balances reserves as set forth in your packet.
So moved, Lanny Wilson.
Second, Mindy.
Motion by Dr. Wilson, seconded by Ms. Finch. Mike, can you explain to the board a little bit about this particular issue, please?
Yes, this particular issue, we're requesting approval to use general fund reserves to pay for a couple of the projects that were originally approved by the Board of Health. We were anticipating the ability to use CARES Act dollars to pay for these projects. Over the course of the last 6-9 months, the U.S. Treasury guidelines that were released have changed quite a bit in terms of their definition of cost incurred. Initially, we thought we would be able to prepay for some of these expenses, and as we've become closer to the 12/30 deadline, the clarification on what cost incurred and what needs to happen by 12/30 has changed a bit. The new guidelines require either the procurement to be received and in service, or the contractual service to be provided, construction projects to be completed for us to use CARES funds. So this motion allows us to complete those projects using our general fund balance to do so. It also kind of pairs with the next motion regarding the use of grant applications dollars in order to fund these two particular projects.
Thank you, Mike. Any questions of Mike or anyone else regarding the motion? Okay, there's a motion and a second. Hearing no further questions or comments, roll call, Penny, please.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munir,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks.
Aye.
Mr. President, the motion passes.
Thank you. Moving on to item 8.1, I'll entertain a motion to approve the transfer of funds to the designated line items in fiscal year 2021 budget as set forth in the schedule of transfers in your packet.
So moved.
And
Motion by, was that Ms. Bottoms? And seconded by Mr. Spadoni. Any questions, comments on this? Hearing none, seeing none, roll call, please.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munir,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks,
Aye.
Dr. Wilson.
yes.
Mr. President, the motion passes.
Thank you. Moving on to item 8.3, the revised Board of Health meeting schedule. I'll entertain a motion to approve the revised 2021 Board of Health meeting schedule as presented.
So moved.
Motion by Dr. Scouten, seconded by Ms. Geider. Any questions, comments? And of course, as you see, we are not having a meeting in January, and we will have a regular meeting in February as opposed to our retreat. Hearing no further questions or comments, roll call, please.
Dr. Scouten,
Yes.
Mr. Spadoni, Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munir.
Yes.
Mr. President, the motion passes.
Thank you. Moving on to item 4, purchasing. I'll entertain a motion to combine and approve items 4A through Q without objection. These are all purchasing and procurements through the health department.
So moved, Wilson.
Second.
By Dr. Wilson, who seconded?
Second.
Second by Dr. Scouten. Any questions or comments on any of these items? Hearing none, seeing none, roll call, Penny, please.
Dr. Wilson,
Yes.
Ms. Bottoms? Ms. Bottoms? Oh, I see her shaking her head, yes. Okay, Ms. Finch?
Yes.
Ms. Geider?
Aye.
Dr. Hussein?
Yes.
Dr. Munir?
Yes.
Dr. Scouten?
Yes.
Mr. Spadoni?
Yes.
President Tornatore?
Aye.
Dr. Weeks?
Aye.
Mr. President, the motion passes.
Thank you. Moving on to item 9, unfinished business. Do we have any unfinished business for the board? Any unfinished business by anyone? Okay, moving on to new business. Does anyone have any new business to be brought before the board? Hearing none, seeing none. Our next meeting will be February 11th, 2021. We have the month of January off, and we have no executive session. And before I'll entertain a motion to adjourn, I want to wish everyone a happy holiday season. Happy Hanukkah, Merry Christmas, Happy New Year. Whatever holiday you happen to celebrate, I hope you and yours are healthy and happy and get through the holiday season in the healthiest and happiest of fashions. There being no further business for the board, I'll entertain a motion to adjourn.
So move, Geider.
Motion
Second.
by Ms. Geider,
Wilson.
seconded by Dr. Wilson. Hearing no objection, roll call, please, Penny.
Ms. Geider?
Aye.
Dr. Hussein?
Yes.
Dr. Munir?
Yes.
Dr. Scouten?
Yes.
Mr. Spadoni?
Yes.
President Tornatore?
Aye.
Dr. Weeks?
Aye.
Dr. Wilson?
Yes.
Ms. Bottoms?
Yes.
Ms. Finch?
Yes.
Mr. President, the motion passes.
Thank you. And without objection, we're adjourned. Happy holidays, everyone. Thanks
Thank
for
you
your
so much.
diligence.
Thank
Hanging
you.
in.
Happy holidays.
Good job.
Holidays.
Take care, everyone.
Aye.
Bye.
Thank you all.
Great
Bye-bye
job,
now.
Penny. Great job with all that reading. Wow.
Thank you.
Great job, Penny.
Yeah.
Thanks.
You too, Adam.
Bye, everyone.